Welcome, everyone. We've got just about 5 more minutes until we get started. So you get comfortable, get some water.
For the past 25 years, I've been helping people with different types of disabilities. I was an audiologist. I've worked with people with hearing difficulties. I've dedicated a lot of time to helping people who are going through hardships. When I was diagnosed with Parkinson's, my world tipped on its axis. It was devastating. I was overwhelmed. I was scared. I thought that was the best I was ever going to feel, and then it was all going to be downhill from there. It was a really lonely, isolating time. When I left the doctor's office that day, I was given a script for some meds, an appointment for a few months out. I left without any local resources, not knowing where to turn for help. My name is Lauren Simmons, and we're in Orange County, California. I was first diagnosed with Parkinson's disease about 4 years ago. After my diagnosis, I went home and Googled Parkinson's and found the big national organizations, which are great, but I didn't find any local resources. I didn't know what support groups were in my area or exercise classes or anything like that. It was really difficult to find. I want to make it easier for other people. I don't want anyone else to feel the isolation again that I felt when I was diagnosed. I want those people to know that other people are there for them and to be able to get in touch with them as soon as possible. A couple of years ago, after noticing time after time that there are people with Parkinson's that didn't have resources available to them soon after diagnosis, I decided to do something about it. So some friends and I got together and we decided to come up with pdbuzz.com. We wanted one place for people with Parkinson's to go to find all the resources available to them. We're just a group of people with Parkinson's helping people with Parkinson's.
My name is Claire McLean. I'm a physical therapist. I have a doctorate in physical therapy, and I'm also a neurologic clinical specialist. I specialize working with people who have Parkinson's, and I've been doing this for about 13 years now. When I first meet people recently after they are diagnosed, they express fear, confusion, stress, anxiety, a lot of challenges. PD Buzz solves the problem of one place to be able to find all the resources in your community. If you Google exercise classes for people with Parkinson's, there will be a number of different hits if you search that. Whereas if you go to pdbuzz.com, all of that information is in one place, and that is probably one of the best things that it's able to provide. It is extremely important for people with Parkinson's to get access to resources as soon as possible after diagnosis to help calm their fears, get them connected with the community, and be able to get started on the new healthy habits that are going to help them live better now and for a long time.
We're getting such good feedback about pdbuzz.com. We're hearing that it's easy to navigate, it's easy to find resources, it's kept very current. If someone wants to know what's happening in the Orange County Parkinson's community, that's your place to go and you can find out whatever's going on. We've got people with Parkinson's using the site, we've got their sons and daughters, caregivers. There's support for everyone involved in Parkinson's on there. We need the doctors to bring awareness to PD Buzz because getting their patients to resources early can make all the difference in their outlook. If I knew then what I know now, things would have been very, very different. I am healthier now than I was 4 years ago at the time of diagnosis, and I had no idea that that could happen. There are so many resources available to me, and many very close to my home here in Orange County, but I didn't know at the time that those were available, and they completely changed my outlook on the disease and overall my quality of life.
All right, so that is a great introduction. So welcome everyone to our JumpStart meeting number 2. My name is Claire McLean. I'm a physical therapist. I specialize working with people who have Parkinson's, as you just saw in that video. And Lauren, my co-host here, and I are excited to have this meeting. We've been talking about this for probably a while, a couple of years even maybe, of how to, have a meeting to really try to reach people who are newly diagnosed sooner, to help them know about the resources that are available to them and help them get started with things like exercise and the things that can really help them feel better now and also probably influence things over the long term, like the progression of Parkinson's. And so this is our second time doing this meeting, and very appropriate. It's Parkinson's Awareness Month this month. So hopefully, each of you take something away from this meeting, where a new resource to look up, something in your community, a way, something having to do with neurology and who you see as a neurologist, or how to get started with exercise. So we're going to be covering lots of different topics kind of in a somewhat brief way. Our focus is on resources that are here in Orange County, but also a lot of those same types of resources are things that will be available in your area, even if you live anywhere else in the country or even somewhere else in the world. The other good news now is that there are a lot more resources online as well, which is really helpful if you do live in an area, in a more rural area or something where there maybe isn't as much right where you live. So that was a brief introduction to me, and we will just go ahead and get started with the meeting. So I'll turn it over to Lauren so she can share a little bit of her experience, and then we'll get started with the meeting with Dr. Bixby.
Thanks, Claire. Like Claire said, my name is Lauren Simmons. I'm in Orange County, California. I was diagnosed about 4.5 years ago at the age of 54. And if you just saw that little video, it was really, really tough. I did not expect it. And it was a really hard time. And today, 4.5 years after my diagnosis, I am so much healthier than I was then. And I had no idea that that was possible. I can move better. My confidence is better. My mood is better. My overall health is better. And I never want anyone to ever have that feeling again that that's the best they're ever going to feel on that day of diagnosis. I want everyone to know that there are things you can do. It's not easy. There's a lot of hard work you've got to put into it, but it's possible, and you can live well with Parkinson's. So that's our goal today, is to get you, to jumpstart you living well with Parkinson's. So our first speaker today is Dr. Mindy Bixby, who is at Scripps in San Diego, and she is a movement disorder neurologist. She's my movement disorder neurologist. She's also my friend, and she's just awesome. So if you have any specific questions for Dr. Bixby, you can put them in the chat, and we will try and get those to her. So Dr. Bixby, I'm gonna have you take it away.
All right. And it's 12:09. She actually messaged me and said that she was available to go on video at 12:10. So we'll see if she's pulling up her video, because we are just running right on time already.
Awesome.
So I see her name, and it's 12:10 now. So hopefully she's coming onto video. I'm just going to wait until she opens up her video to spotlight her. And I'll just share too, while we're having her come onto video. So Lauren, sharing her experience of being diagnosed with Parkinson's and actually being able to be healthier now than she was at the time of diagnosis. And my experience as a physical therapist is really actually seeing people be able to get better over time. Since I have been specializing working with people with Parkinson's for close to 14 years now, in all of my physical therapy experience, there are some people I've been working with for a number of years, ever since I worked at a hospital. And I have clients now that I've been working with and have known for 8 years who are doing better now than they were 8 years ago. So significant amounts of time living with a diagnosis that is by definition progressive. But I think what we're saying is maybe we can push back against that, and maybe we can make it such that it doesn't have to be as progressive. You can actually get really healthy and stay healthy. Okay, now I'm looking for Dr. Bixby again.
We've got Dr. Bixby now, Claire.
And so, yeah, that is what we believe is possible. And we want to be, the group of people who kind of changes what it means to be diagnosed with Parkinson's, and have it be something that is much less scary and doesn't necessarily have to have that same progression that has always been expected. So I will add Dr. Bixby to our spotlight now, and let's see if we can hear you, Dr. Bixby.
Hi, I'm Dr. Bixby. Can you hear me okay?
Yes.
Hey. Hi. I apologize for the couple minutes. I did get a chance to watch the video. I think that's amazing and beautiful, and that's exactly how I feel every day. I mean, you're mirroring everything I say on a regular basis in regard to what we need to do to make sure that we are all empowered with Parkinson's, and ultimately knowing that moving forward, we all are in it together. And so that's the most important thing. I know that today we are talking to many people that have just been diagnosed with Parkinson's, but also some that have had this for some time. And so I want to make sure that I encompass our discussion for everybody that's on the call, but I want to make sure that I do make sure that we have an opportunity to have questions and answers for you at the end of the discussion. And so we'll talk a little bit about Parkinson's and what it is. And we'll also talk about some of the things that you can do for yourself. Ultimately, I know that's part of this whole beautiful way of building on this number 2 presentation to help patients basically feel very educated and empowered. So Parkinson's disease is a dopamine deficiency. What that means is that inside your brain, you have dopamine that is helps you with motor symptoms and non-motor symptoms. Motor symptoms can be a myriad of things, whether it be stiffness that you may feel, a little bit more slow, rest tremor on one side first, and then ultimately at sometimes it may go to the other side. When I diagnose this, usually you have one of those symptoms, or ultimately sometimes when you're walking, you can have some changes with walking, whether it be decreased arm swing, stiffness on one side when you're walking, a little bit changes in your posture, the way your legs are moving, maybe they're a little bit closer together and shuffling a little bit. Some people can have freezing. It just depends. And so the most important thing I want you to know is that every single person will be different with this disease. I do believe there's some subsets of different types of Parkinson's disease, even though I know that's an umbrella term where I have Parkinson's disease, I have dopamine deficiency. But that may be different definitely is different for every single person that has this disease. What I mean by that is that you may be presented with just one thing. You may have a little bit of slowness of movements, and you're not really sure if that's something that you should address. And then ultimately, maybe you'll have another symptom and you start to talk to your doctor about it. Some people may have non-motor symptoms. Non-motor symptoms are symptoms that are not stiffness, slowness, tremor, or changes of walking. It may be constipation, where you feel like you're not going to having a bowel movement more regularly, or not having a bowel movement at all, and you talk to your doctor and actually do something that stimulates you or helps you have a bowel movement on a daily basis. Some people have a lack of smell, where they just can't smell as well, they can't taste as well, or some people may have acting out in their dreams or talking in their sleep, which are 3 things. Those are 3 categories of non-motor symptoms you may have 5-10 years before you ever have any motor changes. Some people have just pain in one area of the body that's like this, they've done everything, they've done imaging, they've maybe even have done the surgery there, and it ultimately has to do with Parkinson's, because ultimately if you overuse that area, whether it be a little bit of tremor or a little bit more stiffness, you can create some changes where pain can come in. And so that can also be an off symptom, which we'll talk about a little bit about in just a moment. And so as you can see, everybody can be different with what they present with and how they go throughout their day and how they go throughout their life. And like what Lauren said is that it's true. A lot of people that I've seen that have been diagnosed with this disease are better off several years later because they've learned that what they can do with their body. They listen to their body more, they exercise more, you take care of yourself in regard to your gut health and what you're eating and how you're drinking, and you're just giving yourself all the opportunities to do as best as you can to actually move forward in this life in a healthy way. And so that's the goal, is to actually make your body and your brain and your opportunities around you to be the best they possibly can be. And that's what PD Buzz does. That's what Rogue does, to move yourself forward in the best way and have a helping hand along the way. And so ultimately, when you have a dopamine deficiency, we usually start first with an opportunity to understand if you truly have Parkinson's disease. Let me explain what I mean by that. So somebody may come in and they have some tremor on one side, and they ask me to see them to evaluate what's going on. And you may have some stiffness or some slowness when I see you on exam. And I know you're probably aware of some of the symptoms or some of the signs that you may be looking for. But again, we do an exam, which is called a movement disorder exam, which we have, I'm sure you're aware of these little things we do and ask you to do. And I look at your body, and your exam starts the moment you walk in the door, or the moment I walk in the door. And I see how your eyes are moving and how your body's positioned. And I ultimately talk to you and ask you why you're here. And while that happens, I'm actually watching your body. And what that does for me is ultimately give me a kind of a roadmap of understanding what's happening in your brain. And so ultimately, after that exam is done, you may have some symptoms that we just talked about. And if you do, then we discussed the possibility of dopamine deficiency. At that time, I do not know if you have Parkinson's disease or Parkinsonism. So ism is usually the term I use before I actually start medication. That medication is extremely important to understand if you have Parkinson's disease or Parkinsonism. So some of you may have tried medication and haven't really noticed a whole lot of change in your body, that the tremor is still there or the stiffness is still there or whatever you were presenting with for your doctor to evaluate. And a lot of times medication is just not high enough. You have to find a balance in the brain. Dopamine deficiency, usually when you start to have motor symptoms that we talked about, stiffness, slowness, tremor, and walking, when those things change, ultimately, usually you've lost about 50% of your neurons in the brain that are making dopamine. And so you want to find the balance. And your brain is extremely, extremely resilient. And so ultimately, that resiliency of your brain, you need to find that little tipping point to get back to where you were before you had their symptoms. And it's different for every single person. Sometimes I start medication that's dopamine replacement therapy. Some of the names you may have heard of are carbidopa-levodopa, also known as Sinemet. It comes in two different formulations, immediate release and controlled release. There's also Rytary, which is similar. It's a carbidopa-levodopa, but a different way of giving it to you in the brain and the gut. And it's immediate and controlled release together. There's something called Stalevo, which is immediate release with something called Comtan, which helps the body not break it down before it gets to your brain. And then there's other ones that ultimately are lookalikes that give you dopamine some other way, whether it be an agonist, which looks like dopamine enough for your brain to believe that you're getting it, so your symptoms get better. And sometimes there's enzyme inhibitors and a whole bunch of different opportunities. And so those are some things we talk about. But the main thing I want you to know is that if you don't notice after you start some of the dopamine replacement therapies and you're not getting better, and you don't see better opportunities for you to feel less stiff, less slow, and less tremorous, or whatever your symptom may be that you want to treat, then there's two ways. One thing is that you may just not have enough medication on board, and we just need to just pump it up a little bit before you get the sweet spot so it starts to feel better. Or you may have a Parkinsonism. What I mean by that is that some people can show that they have certain symptoms that we talked about, but they have another reason why they're having this. Whether some people have a stroke in one area of the brain, which is called the basal ganglia, which is the same place where you're losing dopamine with Parkinson's disease. And so that's why we usually tend to get an image at that time. An MRI of the brain is usually the most important thing for us to see if there's actually stroke there or something else that's happening. And the other thing I do after it's still a question mark in our minds of what's happening, is I may consider something called a dopamine challenge. What that means and what that entails is you coming in off medication, off dopamine replacement therapy, or anything that your doctor may have given you. And we do off testing. And that off testing is something called a Unified Parkinson's Disease Rating Scale off testing. Again, we don't have to write that down, but the idea is all those little things that your doctor asks you to do, there's a rating system with that from 0 to 4. And the more I see, the more tremor I see, the more stiffness I see, or all the things I'm asking, which is several questions that will give you a really good opportunity to understand what's going on in your body. There's a score, and that's your off score. I also evaluate you walking and seeing how fast you do that. That's another part of the score. And then I give you more dopamine replacement in the office than you've had before. So I really try to, that's why it's called a challenge, to give you a little bit more of challenging your body in the office setting to make sure you're okay, and make sure you're doing well with the higher dose. And that might not be the dose you're going to go home on, but it gives us an opportunity to challenge your brain to say, okay, does this really work for you? And so after an hour of taking that dose that we decide on together, we do the exact same testing again. And that's called on testing. Same thing, moving your body. Let me look at you. I'm observing you and giving you a score. Walking you down the hall, have you come back. That's another score. And evaluate the off testing, compare the off testing, the on testing, compare the off testing. And that we subtract that and we see what the percentage of improvement you had with dopamine replacement medications. And if we see that it's at least 40% improvement, we know that we're going in the right direction. And you do have Parkinson's disease. And then we move forward trying to figure out what is the best solution for you. Again, there's a lot of pill forms out there in regard to medications to help you with this disease. But the most important thing is to know that there's a lot of things that we need to do working together and your doctors together to make sure that we give you the best quality of life. And again, exercise, physical therapy, moving, motivating, being around people, and understanding this disease, and knowing that it's very, very, very slow, a very slow progression of this disease, and walking together is the most important thing I need you to know. The treatments are, there's so many treatments and so many different combinations of opportunities to help you. On top of that, I'm sure some of you have heard about deep brain stimulation. That may not be anything we're talking about right now, especially if you just were diagnosed, but that may be something that would be helpful for you based on how you're doing, whether the medication maybe make you a little nauseated or you can't tolerate it, or if you feel like maybe you're living by your medication and you're having dose failures. What that means is your medication, you take it and it used to work really, really well, and then all of a sudden it's not working as well. We start talking about other options for you, whether that be a bridging effect where we give medication that will keep the bridge and keep you nice and even and keeled, like you don't have all the symptoms and they stay away at bay all day long. Some people actually consider doing a pump, which there's a lot of new things that are coming out. There's so much I want to tell you about. I only have a short period of time, so I want to make sure I give you an overview. But there's so many things that are happening in the Parkinson's realm in regard to research and also all the medications that are coming on board very, very soon. We just found out and was just launched, so you're all aware, some of you may be very remote right now, is that we're going to be launching, which again is already started, if anybody is wanting to consider doing deep brain stimulation and ultimately you're in a remote area or it's hard for you to get to your doctor, they just launched the virtual DBS programming where I can do it in my home to your home and program you and with a computer, as long as you have a computer. So there's some beautiful things that are just blossoming in regard to Parkinson's disease and the research that we're doing. And so there's so much to be said right now, but I want to make sure that you feel comfortable about the beginning of this journey with each other and ultimately understanding what exactly is happening, and also to know that you are supported every second of every day. And so I'm going to open up with questions now, if you have any. I would love to start that if that's possible.
Yes, that would be great. So I will, and so Lauren, I saw you unmuted as well. We both can ask questions. I might even just add us all to the spotlight. Okay, whoops, wrong person. Let's see, remove spotlight. Okay, I'll do Lauren. Lauren, did you have questions?
I did. Dr. Bixby, I know that people who are newly diagnosed might see on the forums, it's all over the internet, that the Sinemet or the carbidopa-levodopa wears off in so many years and you shouldn't start it right away. And then other people say you should. Can you address that?
Absolutely. Thank you for the question. They've done, in the last several years, they've done several studies in evaluating people, huge populations of people, and understanding what is the thought process in regard to that. Because you may talk to one neurologist and they'll say, okay, it's not good to start, wait as long as you can. And unfortunately, I get a lot of those patients have been waiting for quite some time and they haven't lived the best quality of life. And then I have other ones that, okay, let's do this. The moment that they walk in the door, let me help myself. And so the understanding of the clinical trials and also all the patients that I've seen over the last 16 years lifetime is that the understanding is that medication is helping you. It's moving and allowing you to have the best quality of life now. And so it has not been shown that over time it loses its effectiveness. The whole idea of the medication having to go a little bit higher on the dose as time goes by is because you're losing dopamine receptors and dopamine abilities to make dopamine neurons over time. And so that's why you tend to need more to keep the balance. Let me give you an example. Let's say I have this wonderful lady. She's 53 years old, a little younger. Again, 55 to 65 is the normal age of onset for Parkinson's disease, but my youngest person I've ever diagnosed is 26 years old. My oldest is 102. And so here we are. We have a very large spectrum of life. And so if you imagine if somebody is having this diagnosis at 52, for instance, and they are having significant amount of symptoms, whether they have tremor or stiffness or slowness, because they just really have never been addressed or looked at as a possibility of having Parkinson's disease. If that patient doesn't start medication, that daily life and exercising and taking care of themselves is much more hindered because they're not on dopamine replacement therapy. So the idea now, when they do the studies, is that somebody that started the medication at day one, compared to somebody that started at six years later, it's the same amount of medication that they'll be on as time goes by. And there's no change in that. It's not that you're losing opportunities for this medication to work because you're starting it earlier. It's more the fact that how much medication you're going to need as time goes by, because you're trying to keep the level nice and happy in your brain. And so I absolutely believe that I need you to start earlier than late, just simply because I want you to have the best quality life ever. I think somebody told me, it may have been Lauren, is talking about your gas tank and how you may be driving on very empty as time goes by, and how well your machine or your car is going to run if you do that on a regular basis and you don't put oil in it and you don't do the things you normally would do for it. And yes, it's going to run for a while, but if you take care of it and lube it up and make sure you have all those opportunities for yourself, then you may, and there's no question in my mind, you will feel better as life goes by and be ready for the next thing that's going to come on board in regards to new treatments and opportunities, because your body hasn't gotten used to being so stiff and so slow and with the tremor, because you've been able to treat yourself with dopamine replacement. What a wonderful opportunity. In 1956, this medication was just available. Before that, it was not. And so these people were having more stiffness or slowness and difficulties getting around, and that hinders you in your life. I want you to have the best life starting right now. And so I would say start medication as soon as you can. And again, we talk about this. We're a team. We make the decisions together. And so if it feels like, okay, this is not the right combination, well, let's get you the right one so you don't feel like, oh, I'm not going to do anything, because that's definitely not the solution.
Yeah. To add to that, I would say kind of my perspective as a physical therapist, one is that I think just how people think about it, like this is not a medication. Yes, the main purpose, it does help symptoms, but it's not like it's just putting a Band-Aid over it. It really is kind of helping that underlying problem of not having enough dopamine. Levodopa essentially gets turned into dopamine in the brain. So a lot of times I feel like if we compare it to a vitamin, like I'll ask someone, if you had a vitamin, like a B12 deficiency, would you consider supplementing with B12 to make sure you had appropriate levels so that you didn't have, experience the effects of B12 deficiency? And, pretty much 100% of people say, oh yes, I would definitely consider taking B12. And so that's where I think just how people think about it is kind of important. And there is so much misinformation and misconceptions out there about medication and if it does or doesn't work. There's a lot of people like on the internet where they'll say like, carbidopa doesn't work for me. And that may be because they don't have Parkinson's, but they don't know that. Like you were saying, whether someone has Parkinson's disease or a Parkinsonism or some related diagnosis is important. And that's why, having a doctor that you can really communicate well with, that you can ask questions to, and have a really good working relationship is so important. And that's why we, want to have Dr. Bixby here so that you can see what it's like to work with a neurologist. And if you have a neurologist that you don't, just communicate really well, or you don't feel like you get the chance to ask questions, it's a great idea to get a second opinion, try seeing another neurologist so that you really get the best care possible, because, the care you receive in the first few months or years after being diagnosed is really what sets the stage for the rest of your life. And so the better you do right from the beginning, the better your life will be over the long term.
I absolutely agree, for sure.
Even to back up a little bit prior to medication. So a question that we got ahead of time was just, what is the difference between a neurologist and a movement disorders neurologist? And how does someone find a movement disorders neurologist?
Okay, great question. So you can go on the MDS website, mds.com, which is movementdisorderspecialist.com, and it will show you quite a bit of lists in your area. Also, there's beautiful opportunities. I believe PD Buzz has a list of movement disorders in your area of Orange County. Is that correct?
Yes.
We also have many resources through the National Parkinson's Foundation, MDA. So Parkinson's Movement Disorder Association Alliance has also had quite a bit of listings on where you can find a neurologist. And the other question was, what's the difference between a neurologist, a general neurologist, and a movement disorder specialist? So from my experience, I actually did a fellowship in movement. And so I did a 2-year evaluation of understanding what's out there in the world for you as a patient. And ultimately over time, I hone in on those skills. And I've been really lucky for me to have the exposure to be able to see patients, because they also teach me, just like I teach them, is to move forward in understanding what's important for each patient. And so if you're always being exposed to patients on a regular basis and seeing them, and ultimately going through your training and also doing your more trainings. We do a lot of continuing medical education in regard to Parkinson's disease and other movement disorders. You tend to have an opportunity to actually see more, and that's why you can be able to help more, because the little nuances of things that you may be experiencing may be able to be helped. But if you don't address them, unfortunately, you're going to miss out on opportunities. And so that's why I think the movement disorder specialist is really important, at least once a year, even just to kind of hone in and say, okay, how are things going? What are the things that are new and exciting in Parkinson's disease? But also, hey, I have this symptom and I'm not sure if it's Parkinson related. And sometimes people just like, no, it's not, because it's the gut. What? The gut is so important in Parkinson's. And so, yes, absolutely, your gut is involved with Parkinson's disease. And so is your heart, and so is your liver, and so is everything in your body. And so I want to make sure that you get the whole wonderful opportunity to be educated about your body and what's happening with Parkinson's. And again, also no, it's not happening from Parkinson's, because some people, unfortunately, some docs and some people say, oh, it must be Parkinson's if I have Parkinson's. And ultimately, unfortunately, may not get the care they need for something that's completely opposite of what they think is happening. And so you've got to look at the whole picture. And that's basically what a movement disorder specialist does. This gives you an opportunity to say, okay, what's going on and how, and want to make sure I ask you every question all the way down to your toes of how you're feeling and how you're doing, so we make sure we address it.
Mm-hmm. Thank you.
Claire, can I ask a question? It's Bill from Canada.
Sure.
Dr. Bisky, thank you so much for your talk this afternoon. I had 2 very different questions.
Sure.
They both have to do with dopamine. The first one is whether there are natural ways to increase dopamine. And the second question is, I'm on the dopamine medication, which I can't remember the name of it, but it's the one that you began with.
Mm-hmm.
Is there some advantage to taking it earlier before the meal? I had read some things.
Great questions. And you know how many people will want to ask this question, and you did it, Bill. Thank you. And so the first one is that there are some natural products that are out there that are from something called Mucuna perennis, which ultimately is a plant-based product. And again, we'll type this for you later. And so the thing about it is that it is a natural way of getting this medication, but you can't, sometimes you have to do such a huge amount of it to get the same amount of dopamine replacement treatment than you do in the one tablet you're taking, the yellow pill of the carbidopa-levodopa. And so sometimes it gets too much for people, because it's depending on the batch that you get, because again, I have people that are actually getting it from Canada, and it comes in a form of almost like a powder form. Other ways, of course, they do it too, but usually you need more of those. That sometimes they do the capsule forms too, but it's definitely not as potent. And so you may get one day a good day, next day not sure, or you may be chasing it on a regular basis. And so I'm not against it. I think it's great. Some people are on it and they use it and they feel like, okay, I can tolerate it this way. And I think it's great. But you have to just know that it may not always be the same day every day by using a natural product, because you just don't know how much you're getting on a regular basis. The second thing that we know for sure that increases your dopamine is exercise. And so your dopamine levels are super important in regard to exercise. And you'll notice that you may not even need as much medication if you exercise on a regular basis, at least 30 to 45 minutes. I like a little bit of a moderate intensity to high intensity workouts with very forced movements, like big movements. But again, it depends on what your capabilities are. Some people are still exercising and they're not able to move very well in regard to their legs working. They do chair exercises, but there's still so many things you can do to actually move your body. Why do I say that? One, it does pump up your dopamine levels. There's no question. Your endorphins kick in, everything else. But ultimately, also what it does is it tells your body and your brain how you want to move. And so if you continue to be stiff and slow, your body and your brain is like, oh, this is my new memory. This is how I should be feeling. And you don't want that to happen. So you want to overcome that, re-educate that brain so it actually uses the dopamine the right way and you don't get stiffer or slower. The second question, when it comes to carbidopa-levodopa, depending on how well your gut is metabolizing that medication, it needs to be at least 30 minutes away from proteins and fats. That's a really important thing. On the bottle, a lot of times in the US, they'll say every single drug, please eat with food. That's not the case with this medication. Why is that? Well, the medication that you're taking is metabolized in something called the duodenum, which is the small intestine area. That's the same place your food is absorbed. So guess who's going to win? Your food. So you're going to get very expensive stool. So I want that medication to work the best it can, but if all those receptors are full with food, it's not going to work. And that's why I usually have some people say, I don't know why I did great all these days and all of a sudden it's not working for me, Dr. Bixby. I'm getting sick and getting worse. Why? And it's usually, this disease is slow, very slow. You don't wake up and all of a sudden have more tremor, stiffness, slowness. It doesn't happen that way. And so if you feel that way, it may be that you're having an infection, you may be really constipated, or you had a big piece of meat and you're eating it and it's still ruminating in there and it's not getting metabolized as well. So I always ask you to please, when it comes to nutrition, if you're going to eat the high protein meals, which again are important for other reasons, so please do not stop eating protein. I want you to have a palm-sized portion of it, and the rest of the wonderful plate that you have is very colorful, very rainbow-like. I mean, fresh vegetables, fresh fruits, and good things for you, okay? Because that has been shown across the board to be much more effective for you in regard to your gut health, especially with Parkinson's gut. Let me explain Parkinson's gut. Parkinson's gut it's gastroparesis. Gastro meaning gut, paresis meaning a little bit slowness of the gut. And some people don't have that, but a lot of people do. And if you don't address that as, okay, my gut's going to go a little bit slower, so smaller meals are so much better. You want to make sure that you keep your medication before or after meals. So let's say you eat something, you wait a half an hour and then you take your medication. If you take your medication, you wait a half an hour and then you eat. If you have nausea with this medication, I say, please, it's okay if you want to take a carb in, because metabolism of a carb is really fast. I'd much rather you have a vegetable or a fruit or something that's actually quicker, little saltine crackers. If you need that for nausea with the medication, that's absolutely fine with using it together. You may notice it doesn't work as well, but usually you get the effectiveness if it's not a protein or a fat that you're going to use. Does that help?
That's great. I was hoping you were saying the natural form would be more ice cream or more chocolate.
I wish I could say that. And you know what? I mean, people have such huge cravings for sugars with Parkinson's. And let me tell you why. It's because it actually keeps your limbic system, which is your impulse control, higher. So your dopamine gets a surge, but then you drop. And so I'm careful with it. I want you to enjoy your chocolate and your cookies and your ice cream, but think about that as a thought process. It may give you a little bit of a bump, but it may make you go down a little bit quicker. So I want you to have a good quality of life. I think everything in moderation is absolutely beautiful, and not to eliminate anything from your diet if you love it, because this is our life. We're walking through our life every single day. We want to feel good. It's just be thoughtful and modulate it a little bit, and you'll do great. So that's how I feel.
Thanks so much.
Of course. Nice talking to you, Bill.
Thank you. And then Nancy raised her hand. So Nancy, if you want to unmute, just so everybody knows, there is a hand raise function, and that helps. And I've written down other questions too. We'll keep going through those. So if you put one in the chat, we will get to those as well. Luckily, we still have a good amount of time. But go ahead, Nancy.
Okay, 2 questions. My present doctor here in Orange County, and Claire and I have discussed this several times, they want me to take a CL 4 times a day. I'm not getting much effect with it. Then they put me, because my symptoms seem to be more stiffness and slowness.
Okay.
They put me on an additional medication called, starts with the P, generic.
Pramipexole? Was it Pramipexole?
Yeah, I think yes. So I started that. It was causing me insomnia during the night, so they got me taking it now in the mornings. Eventually bumping up to 2 a day. But one of the reasons Claire thinks I should consider bumping up my CL. And I don't disagree with her. I'm just trying to be a good little patient because I'm only 4 months in. So I haven't gotten defiant yet. Give it time. What should I do? And also one of the reasons that what they say appeals to me, and this is part of my second question, so you can answer it in one effort, is that I've read a lot where if you take too much CL, you get other movement side effects.
Okay. So the first thing is, let me close this door so I can talk to you.
Ooh, that
And
could be a
I'll
private
let Dr. Bixby. So Nancy was taking a little bit more before she was on one, and her symptoms were better controlled. So that's why I've said, let your doctor know that that's what you experienced, that you felt better on a little bit more.
Yeah, and I've only bumped it up though by half a bill. I mean, I have my voice. I didn't used to have my voice. So I'm very pleased with the CL, but 4 times a day is just, I'm sorry, it's just not, it's not satiable. It's not sustainable. There's the word I'm looking for.
That's a good word. So first of all, yes, your voice sounds wonderful. 2, Nancy, I can't give you individual advice because I don't know.
Right.
But I can give you an overview of understanding of what normally we do when we first start this medication. So my goals are always to make sure you're not living by your pills. And your life is not always like, okay, where's my next time? Oh, I don't want to miss my next time. And so some people, it isn't sustainable to do it 4 times a day. So you find the maximal way of doing it 3 times a day, and sometimes differently depending on what medication you're on. And so when it comes to controlled release, the difference between taking too much and taking too little, that would be with any type of carbidopa levodopa medication. And so it's not necessarily the controlled release that will change your symptoms in regard to going higher compared to other formulations of the same medication. So I want to just make sure I debunk that first. The carbidopa levodopa, again, cutting it in half, depending on, because again, it's controlled release. It's in a wax matrix. And so when it's in the wax matrix, it means it spits it out throughout the day. And that's why controlled release is controlled, especially with that type of formulation. And so when you have a wax matrix that controls it, when you cut it in half, it no longer is controlled release. It's an immediate release. And so that said, a half tablet of that may not be what you think you're getting. The other thing about controlled releases is that because it's in a wax matrix and it's not as efficient at getting to you, again, it's a great medication for controlled release because it does you get it spit a little bit over time more. But the idea of the controlled release is that you don't get the maximum dose of that medication. So let's say you're at 50/200, you get about a 70% amount of that dose per 100. So you're getting 140 milligrams of the controlled release if you're taking the full tablet. Again, usually the starting dose of this medication, controlled release, immediate release, we just do the math, is 1 tablet 3 times a day. Why is that? Because usually the half tablets, again, depending on your symptoms, and everybody's different and you're individual and you have stiffness, you have slowness, and how much stiffness, how much slowness. I don't know any of those answers because I don't get to see you in my office. But the idea is when we see somebody and they come in with some symptoms of Parkinson's, that's how it helps us modulate what type of medications you're going to be on, what you should be taking. And I'm very big about making it as clean and as efficient as possible for you because you're living a life. And most people miss half the middle dose. It's just a normal human trait, unless you have a lovely, like 3 or 4 alarms going on. I mean, and you don't want to carry this in your pocket. Just kidding. But the idea is that you have to kind of.
They want me to carry this, my phone, set off alarms.
Again, if you're carrying it out anyway, I mean, we have so many ways to get it for you. But the idea.
Right.
You get a chance to talk to your doctor about the fact that can you clean up my medication so I'm only taking it 3 times a day because that's doable for me. And again, this diagnosis and this treatment plan has to be individual. So your lifestyle may be very different from the next person that sits in my chair to talk to, and maybe that's just too hard for you to do that. And yes, there's a Pramipexole that's a controlled release that lasts all day. So that may be a good offering for you for
that's the one I'm on. I forgot. I'm on that one because to sidestep the nauseousness and other stuff, it was more sustainable.
Yes. And so what if one of the questions that you talk to your doctor about is, hey, why don't I try this at a pramipexole at a higher dose and not take the controlled release if I have to take it 4 times a day, or consider maybe taking a full tablet 3 times a day, which will give you a nice, wonderful boost every time, and maybe give you a nice even keel, so you're not feeling like you're stiff and not stiff, stiff and not stiff, not stiff and not stiff, because that's not fun either. And so there's a lot of options for you. I mean, you have like this huge amount, and so to hone it down and make it simple for you is the most important thing, because your life you don't want to live by your pills. You want to live by your life. You want to go do things. You want to go do, have life and not forget things and not worry. Okay, I have 4 times a day. I got to do this. I have to get my food somehow in there at the
Right.
same 30 and after. So the goal is to actually make your life better. And so what I tend to do is have people do a Parkinson's disease diary or journal. And sometimes I
Yes.
just days of, okay, what's going on with you? Because I can't walk around in your pocket. I would love to, but the idea is that if I have a wonderful sheet that gives me a beautiful picture of your life, it may help me understand what your body will need. And so we're kind of in this newness in you because you're learning about this, and you may do wonderful. And again, a lot of times, I mean, again, you're my partner. If I was your doctor and I need to know what's going on, and the more information you give me, the better off I'm going to be with that, be able to help you. And so if you are like, okay, I wake up in the morning and I'm stiff and I'm slow, and I take my medication, my half tablet of Cinnamon CR, and it kicks in about what time? That's another part of the plan. You look at the diary. Oh, I feel good. I still have stiffness. Oh, half an hour. Okay, I don't have stiffness anymore. I have any slowness. I feel awesome at 45 minutes in. So you now know your on time is 45 minutes from when you take them out in your mouth, goes through your gut, metabolites in the bloodstream, goes to your liver, and then finally gets to the brain. Your timing is 45 minutes. And so what do you do with that 45 minutes? So we kind of play with that too, to understand what your body and your gut is doing, and so that we can get you the right dose, so you feel good and you're not missing out on opportunities to actually have your life not be always medication, if we can. Okay, so adding another pill sometimes makes it even more, because you're like, okay, I'm juggling this side effects, I'm juggling this side effects. I like to maximize one medication first. And if I need to add something, that's when, if it comes to having a side effect, or you're going to have to do too much of that, then I incorporate another medication. That's kind of how I do things. But again, that's my way. But if you want to be basically a partner with your doctor, saying, okay, these are the things I've seen, and if I can do, let me show you what is happening. I kick in about 30 minutes into my dose, and it lasts me until about 11:30, and then I'm going to need it again. Would you think if maybe I could take a little bit more at the beginning of the dose, and maybe it will give me another 2 more hours, and then I don't have to
So you can eat lunch.
pill. Yeah. And so there's some beauty into the fact of understanding kind of what your gut, your body's doing, and then bringing that to them, because they only have 20 minutes, 30 minutes, 40 minutes with you, and have an opportunity to be able to go, okay, I'm ready. I have my notes on me. Let's make sure I discuss the 3 things that are most important to me in this visit, so you don't walk away with more questions. Super important.
Gotcha. All right. Thank you very much.
Oh, of course. Absolutely.
Know that there are almost like endless options. So there are so many ways that things can be tweaked to be optimized. And that's where, like, I just really try to coach people to bring the best information possible to your neurologist so they can help you the most in the most efficient way. If you come and just say it's not working well, or sometimes it works, sometimes it doesn't, but you don't have the details, it's much harder for the doctor to know exactly what type of tweak needs to be made. So really, like, documenting things for the week before you go and see them, really keep good track, because then you will be able to get so much more out of that visit than if you just kind of arrive and you're like, well, things aren't going that well, but you can't say exactly how. Then the doctor's like, oh, got to try to figure out, what is or isn't going well. And it can be somewhat complex.
Mhm.
So there is the better information you bring to your neurologist, and then just, again, you want a neurologist who's listening, answering your questions, working with you, as a team. That experience, I think, is really important.
They've encouraged me to send emails. They've encouraged me to send emails, and it has worked very well.
Good. All right, Maureen, I see we have a hand raised. Go ahead and answer or ask your question.
Yes, I have a question. Newly diagnosed about 3 months ago, and I think I probably had this for quite a few years before I was aware of it, because I had a little shake in a leg that would come and then go away for months on end and then would come back again, and nobody paid much attention to it at my doctor's. But anyway, now that I've been diagnosed, about 2 months ago, I was put on Levocarb, 100 per 25 milligram dose, I guess what I'm wondering is, how much can they give you? Like, what's happening with me is I take this in the morning, then in the middle of the day, and then again at close to bedtime, 3 times a day. And I get about an hour and a half before I'm to take my next pills. And then my right arm and right leg start to shake again before I'm due to take my next ones. Now, I guess what can I expect when I next go to see my neurologist on May the 27th, because it's every 3 months kind of thing. And what can I expect? Am I going to be able to get is that a high dose? Is that a medium dose? Is it a little dose? What is it?
Okay, so the maximum dose of this medication is 16 tablets
Per day?
per day.
16 per day. Oh, so I'm at a small dose.
Correct. And
So they can probably up that for me or do in some way so that I don't have these breakthroughs.
absolutely, that's the whole goal. And so I want you, if you can, before you meet that doctor, is to actually write down when you're starting to wear off and have a nice consistency for at least like a week or so. So you're like, this is what's happening. Usually I would suggest, I would recommend, and again, this is not me, is that usually you just go up and you bump up a little bit so you get a better, longer duration of the medication working for you. Again, the other reason why they start you at 1 tablet 3 times a day is the normal book dose.
Yes.
That's going to be your dose, just because everybody's different. They just want to make sure it's working for you. Usually a lot of times we start that medication at that dose just to see if his tremor goes away. And you did.
It has helped me a great deal. I mean, I'm able to write now and not shake while I'm writing and write really tiny. I can write my normal, and what's funny is my family is full of essential tremors. So that's what I thought I was going and looking at. I mean, it's everywhere in the family. And here I am, the one with Parkinson's.
Yes, I get it. And that's, I would love to talk a little bit about that too, just so you're aware and everybody else on the call is aware. A lot of people actually get diagnosed with essential tremor for many years, and they're throwing all this different medication on them and it never changes them, but that they're like, this is the gold standard. Maybe you just don't get better with that. And the difference between essential tremor and Parkinson's is that Parkinson's is one-sided with rest. When you're not paying attention, your leg starts to shake, or when you're not paying attention, your arm starts to shake. With action postural tremor, which is essential tremor, it's usually at the beginning, both sides, both hands, and you don't usually see it anywhere else. Sometimes as time goes by, having the essential tremor for 10 or so years, you may see a little bit in your legs, but nothing that's substantially the first thing you see. The other thing about it is that I have people that have both essential tremor and Parkinson's disease. Oh. And that there's a gene that's located, it's called LINGO-1 gene, and it connects those two diagnoses with these patients. And so again, family history of essential tremor is much more prevalent, probably about 80% of people that have a family history when they get this diagnosis of essential tremor. When it comes to Parkinson's disease, it's much less. It's about 20 to 25% of people that have a genetic marker. Somebody in their family gave that gene to them that actually expressed in them. And so a lot of people have the genes and they never express them. It just depends on environment and life and basically your brain deciding to have that. And so I'm glad that you were able to walk in there and say, okay, these are the things, and they actually gave you the right diagnosis.
I had a Zoom diagnosis.
What did you say?
I had a Zoom diagnosis.
Okay, there we go. Well, John, I say that doctor is very astute. That's a wonderful thing. Yes, we do a lot of virtual now because of COVID. So I have 2 days a week that I'm actually doing virtual. So you have to get really savvy with it. You have to make sure you're looking at the right things, and there's a lot of light and you can see everything, but I'm really happy that you're able to feel better. That's wonderful.
Thank you for answering my question. I've been living with a lot of fear and a lot of sadness. Yes. And anyway, I'm just glad to talk to people.
I'm so happy that you have us. Every step. I want to give you a hug through here so bad.
Hello from Canada. I'm in Canada.
Oh, well, can I come visit? I love Canada.
Well, I'm on Vancouver Island on the West Coast.
Oh, that's fantastic. Well, I have a lot of family members that have Parkinson's as well. So I've lived through this for a very long time. And before I was a movement disorder specialist, we didn't have any Parkinson's patients that are family members. And I'm like, oh, you have Parkinson's. That was very interesting to diagnose this disease to them. But they're all doing great. And I'm sure you're going to do wonderful too. We're all here.
Lots of exercise. And I have a good physiotherapist that's coming to my house now. So
that's fantastic. Fantastic. Okay. If you need anything, please don't hesitate. Okay. We're all here.
Thank you so much.
Of course.
Yeah. And that's exactly why we're doing this meeting is we know, that at the beginning, there is a lot of fear and unknowns. And often you do only get to see your neurologist for very short periods of time. And there isn't necessarily the time to get to ask all these kinds of questions. We've been on almost an hour here, and I mean, we still have a lot of questions. So we understand that there's a lot of questions, and that getting more information, being able to ask those questions is really what kind of calms those fears and allow people to get started and, put one foot in front of the other, and then all of a sudden start to feel a lot better. So we do only have a few more minutes of Dr. Bixby's time. We really thank you so much for being on, but we also want to be respectful of your time. So I'm wondering if we could do like a little bit of rapid fire where I ask you just a few questions and you give kind of the shortest answer possible.
Yes. Sure.
So one is, someone said, what if they come into your office and say, what can I do to slow down progression? What are like the top few things that you would tell people that they may be able to have an influence on Parkinson's progression over time?
Perfect. Eating well. You have to eat well. No processed foods. Decrease your meat. Decrease your cow milk products. Exercise, exercise, exercise. Water, 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 water. Your body is made of water. Your 72% of your brain is water. If you're not drinking on a regular basis, and you're going to ask me how much, I always start out with, thank you. I start out with, that's what's your weight divided by 3. That's how many ounces of water you should be drinking a day. These are going to slow the progression of any type of disease, including Parkinson's disease. If you're not moving your body, ultimately your body doesn't know how to move. And so guess what? You progress in your disease. And so creating a support around you, please tell your family you have Parkinson's. I know a lot of you may want to hesitate and wait. There's no reason why you shouldn't. You want to support every second of the day going forward, no matter what you have. I have high blood pressure. I want you to know I have high blood pressure. Tell people, because you need that love around you, because for everything, for all of us, especially after this COVID moment, we know that's how important it is to have each other. Please.
Thank you. Okay. How about, so this I know is not a simple or short, but just somebody asked about sleep. And so I think I would say sleep is super important, and that's something to talk to your doctor about because, it matters what is going on with your sleep. And that's not something where, Dr. Bixby can just say, oh, this is the one thing to do. It's again, kind of like medication, finding out what's right for you. But yeah, anything you'd say about sleep.
Okay, so sleep, again, if you're not sleeping well, your Parkinson's will seem like it's getting worse because you're tired. Your body is not refreshed. So let me tell you about sleep. What happens with sleep is your brain is beautiful. It does a totally different mechanism. It shrinks, so it allows all that cerebral spinal fluid to go through and clean it up and get rid of all that waste that we all make. And so if you're not sleeping on a regular basis, it's harder for you with Parkinson's or anything. It's thinking right, feeling right. And so emotional changes will happen if you're fatigued. And so ultimately, there's a lot of natural products out there that can help you. I really like Calm, CALM, which is a powder form, which can help you with your spasms in your legs at night. It can help you with your sleep. It can also help you with your, if you're having anxiety at night, some people do. It helps you get to a place where you can fall asleep and it's natural. It is CALM. It's a powder form like the Tang back then. Please do not drink a full 2 tablets of it in water at the beginning because you will have diarrhea. So it ultimately helps you with your constipation as well. So that's one of my options. I talk about light boxes. So you wake up with a light, have 30 minutes of light. So actually you get those neurotransmitters working, that you're awake, because unfortunately we live in the land of computers and keeping ourselves always stimulated. So stay away from light about a half an hour to an hour before you go to sleep, so your body feels good and ultimately moves forward in regard to, oh, it's time for me to fall asleep. So it's ultimately going to sleep, great, good, amazing sleep hygiene practices. Don't drink too much water before you go to bed. You will curse me after I told you how much water you should be drinking. Your water should be drinking and just sips after 6 p.m. so you're not waking up going to urinate constantly at night. So we have to ask you why you're not sleeping well. And then we hone into deciding what we need to do to help you.
Mm-hmm. Awesome. Okay, let's see. Lauren, were there any others that you felt like, I feel like a lot of them were kind of answered already with your questions talking about, how the diagnosis is made, that it's a clinical diagnosis and somewhat looking at if there is a response to medication. Someone asked about if there are any particular drugs that negate the effect of carbidopa-levodopa. Is there a brief answer on that?
Okay, so carbidopa-levodopa, again, my daughter laughs so hard when I say that every day. She's 10. And she's not really good about saying it. there's not a medication that will stop the abundance of it working for you. It's really more of a gut health thing. How well is your body metabolizing medication? There are some dopamine depleting medications out there that I always want to make sure I address the first visit. It's one of those things where that's a Parkinsonism sometimes. Psychotic medications, some medications that you use actually for nausea can cause dopamine depletion. And so you need to talk to your doctor about those things. So I always make sure you always look at your medications, making sure they're all good and comfortable with what you have. But ultimately, usually you would know that was the case because you just, again, over time, people know these things. So you have to talk to your doctor about that. There's no medications that actually would change it. Like a lot of people say, well, I'm going to start this medication, but I have all these medications for cardiac health and all these other things I have to do for everything else. What do I do with these? And usually there's not an interaction because this medication is a synthetic form of what your brain makes. And so your body is actually used to seeing it per se. And so again, low dose sometimes can create, or high doses can create nausea. Again, we talk about how we're going to treat that. And then also sometimes low blood pressure with use. But again, we have to make sure you didn't start out with low blood pressure. So there's things that we talk about. And again, these are details depending on who you are and what you're experiencing and what you're bringing to the table for us to make sure we take care of you in every way. And then again, everybody's individual.
Okay, thank you so much. We went just a couple minutes over. There were two other questions that were just about symptoms and whether or not they were like being helped. And so that's where I'd say, Dr. Bixby has kind of talked about it, maybe not specifically regarding that symptom, but anything that the medication feels like it's helping with, but it's not helping in some way. Either it's the medication isn't helping enough or it's not lasting for a period of time. That's the information you want to, track and bring to your neurologist so that they can make those tweaks, because there is a lot that medication can do when it's just, tweaked slightly. And then also symptoms like, so one person mentioned sleepiness. So sometimes medication needs to go down just a little bit to help with that, but also movement can really help. So if you take your medication, then you feel a little bit sleepy. If you can go for a 10-minute walk, that will often perk you up. And then also a question was about freezing. So that difficulty sometimes people have taking a step, kind of lifting and getting their leg moving. In addition to medication, I think exercise and physical therapy is something that has to be done if that is a symptom that someone is experiencing. I think it's pretty rare for medication to completely eliminate a symptom that is so movement-based. And so then it's really the combination of exercise and physical therapy and exercise together that is crucial in making the biggest impact on a symptom like that. Would you agree with that, Dr. Bixby?
Absolutely. Absolutely. And again, everybody's individualized in regard to understanding what you're going through and what you're feeling. And so, sorry, I was writing on a chat for somebody, is that we have to build your body up. You are going to live a better quality of life, understanding what you need based on all the beautiful things that we have in regard to mind, body, and spirit. And that's what we're doing here. That's why we're here together, is actually making so that we don't miss a beat in regard to what you're experiencing, so we can help you. That's basically why we're all here.
Dr. Bixby?
Yes. Hi.
Hi. I had a question. I have a situation where I'm taking my medication for 2 to 3 days. I take a 50 over 200 and a 25 over 100 every 4 hours, about 4 or 5 times a day. And then I can go 3 or 4 days without taking any medication at all. And I'm wondering whether it's stored somewhere in my, when I'm taking it, it's storing somewhere in my organs or my body, or why that would be that I could, it's like I have a vacation from my medication.
Okay. So again, everybody's different, just so you know. Okay. And in regard to the medication itself, there's a half-life of each one of those medications you're taking. And so sometimes it can last in your system a little bit longer than other people. Also, depending on how well your liver is actually metabolizing that medication, sometimes it hangs out longer. Some people do holidays. I don't usually see the holidays that you're doing, or you do 3 days and then you're off, and then 3 days and then you're off. But again, it just depends on the person. And so you would have to address that with your doctor in regard to why that's happening. If there's something else that's going on in regard to how well your liver is working and how everything else is doing. Again, I'm happy that you have an opportunity to have a little bit of a holiday sometimes from taking medications, but there's not a clear understanding of why that's happening based on the medication and half-life of the medication. But if it's working for you, then we move forward with that and how you're doing, if you're feeling good.
Well, the problem is that when I'm taking my medication, I sleep a lot. I'm off, and I'm having symptoms a lot more. But when I don't have to take my medication, I feel like I don't even have PD.
Okay. And so again, that will have to be addressed with your doctor because it's private and more of an individual thought process. Again, you have to walk the walk of what's working for you and what's not. It depends on how well you do over time without the medication. If you still feel like you're not as sleepy and that's tolerated much better than being on, so you're not sleepy, you have to find the balance between the two things. And so if you're like, I'm sleeping all day long, I'm not having a good quality of life, I don't get to see my family, I don't get to do the things I like to do, but I'm not stiff or whatever your symptoms are, then you have to modulate it and figure out maybe you get a little bit less medication on board and feel a little bit less stiff, but still be able to stay awake. So you just have to find the happy medium between the two things.
Mm.
All right. Well, thank you again so much, Dr. Bixby, for joining us today and answering so many questions. There still are questions coming in, but we will let Dr. Bixby go and enjoy her Saturday. And we'll have another meeting like this again. And if you do feel like you have a lot of questions that you haven't gotten a chance to ask your neurologist, I would recommend, like Dr. Bixby said, really writing things down before you go in to make sure that you remember at the time to ask about those things. You know, what's the most important to you? And if your doctor doesn't have the time or you don't feel like that communication goes as well as you would like, that's when you might want to look and get a second opinion and try seeing another neurologist, you know, to find one that works really well with you, because there can be amazing neurologists in terms of their experience and training. That doesn't mean they're the best one for you. So finding one that you really can communicate well with is super, super important. And, you know, sometimes really impressive resumes aren't the ones that are best, you know, for your kind of day-to-day care. So that's something I just encourage people a lot, is to potentially see, if you've only seen one neurologist, I would recommend seeing another one and, you know, get a second opinion, and also just kind of see what those different styles are in terms of care and find the neurologist that's right for you, because it makes a huge, huge difference in how you feel.
Absolutely.
If I could jump in for just a second, I think as a person with Parkinson's, along that line, finding the neurologist that's right for you, your doctor is there for you. And if you are having an issue and you don't have an appointment for 3 months or 6 months, don't wait. You're not going to bother your doctor. I've heard so many people say, you know, I don't want to bother them, I know they're busy. Most doctors these days have portals. You can, you know, send them an email. Ask your doctor. You shouldn't have to suffer for 3 months, you know, with your medications not working correctly. Advocate for yourself and contact your doctor.
All right.
You're muted, Dr. Bixby.
Yeah.
I don't know how that happened. I would absolutely agree. The most important thing is that we chose to do this, and we're really happy to do that. We want to make sure you're doing well in your life. Again, it may be different for everybody else. I don't know, but I feel like it's important for me to know that you're not doing so well, so I can help you through your life and your journey. If you're waiting 3 months to talk to me about that, it's just not really fair to you. And again, I mean, there's some things that I can help, and we may have to do your primary care doctor to help you, but if there's something that has to do with Parkinson's, I want to be able to be there. And again, that's why we have a huge hub of people that are actually able to support us, because again, that's why we do this. And that's why I'm actually moved to Scripps instead of doing private practice, because it was difficult to make sure that I had opportunities to make sure everybody was heard and helped at an appropriate amount of time. You know, so I agree, Lauren, definitely.
That's why I see you, Dr. Bixby.
Oh, thank you. Well, have a great day. Take care of yourself, okay? And I'll see you.
Bye. You.
Have a good day.
Thank you.
Bye. Bye.
Thank you. Bye-bye.
Absolutely.
Right. So next is our first movement and stretch break. So if you need to use the restroom, please go ahead and do that. If you need to refill your water, so you can keep drinking a lot of water so you can feel better, refill your water. And if you want to do a little exercise with me, we are going to do a little bit of boxing. So exercise is very important. As we've already discussed and Dr. Bixby talked about, there are so many different ways to exercise, different forms of exercise. So hopefully everyone can find something that they enjoy and they like and is challenging for them. There's a lot of research that says you want high intensity exercise, which means we're trying to get our heart rate up. I'm going to take you off the spotlight, Lauren, for just a moment so I can do the demo. So boxing is one of the great forms of exercise that has research to support it. It's very enjoyable. It can be high intensity. And it's one of the types of exercise that we recommend trying. So this can be done in seated if you want to. Anybody who wants to stay in sitting, you can. But I would recommend that we get up into standing for anyone who wants to. I'm going to back up a little bit. And so with boxing, there is an organization called Rock Steady Boxing that is a nonprofit based in Indianapolis, and they are kind of the pioneers of really adapting boxing for people with Parkinson's, to take boxing as a workout, but really optimize it for people with Parkinson's so that they get the most out of it. And it's safe and fun and enjoyable, and you're less likely to have an injury because there's certain forms of exercise that there's possible to have an injury. So we want to minimize that. So Rock Steady Boxing is one of the organizations that we highly recommend looking up. There's lots of affiliates all over the country. So there's a good chance that there is one in your area. So we are going to come up into standing. And with boxing, what we do is there is a traditional stance for boxing where you stand with 1 foot forward and 1 foot back. I'm going to see if I can tilt this down a little bit more so you can see my feet. So I am not necessarily going to be mirroring you, because when we're in our boxing stance, you want to have your non-dominant foot forward, your dominant foot back, and then hands up. So we want to be in kind of this nice athletic position where we can move, we can shift our weight forward and back. And one of the intensive parts about boxing is just to work on staying light on your feet. So kind of bouncing forward to back so that you would be able to take a step forward if you need to, take a step back, or do a squat down. So these are some of the defensive moves that are included in boxing. So if you're left-handed, I might be mirroring you. If you're right-handed, I'm not mirroring you. But go ahead and just try to get in this stance and just try to be bouncy and kind of light and flexible on your feet. Some people notice already that this is a little bit challenging, and this is a really good way to work on your balance and mobility. We have our hands up, even though Rock Steady Boxing and most boxing classes for people with Parkinson's are not combat. We're not actually fighting each other, but we still want to work on these defensive moves and having our hands up. And there's kind of some traditional punches that we learn to do really well. The first one is a jab, where you're going to take your non-dominant hand and punch straight forward. So I'm going to show you from the side. You're going to punch that arm straight forward, get your elbows straight. You can imagine either a person, or you might want to imagine a bag in front that you would be punching towards. And then we want to work on bringing that hand right back in front of us. So it's a jab, punch out, and then right back in. One of the things we can work on with boxing is high intensity, and also work on really good motor control. Like Dr. Bixby said, learning to move and control your body. We can punch out, bring it right back in, and then we're still light on our feet. And then our cross is with your dominant hand across, and we use that right leg or your dominant leg to give you some power as you punch across. And again, we really want to get that elbow stretched out straight. I'll show from the side again, and then right back in front of you. So we're nice and light on our feet. So let's try putting both of those together. So a jab and a cross, back to the middle, jab, cross. Again, jab, cross, back to the middle, light on our feet. Then we have a hook. We're going to start the hook with our non-dominant hand coming around, kind of bringing that elbow up so our shoulder, elbow, and hand are pretty even, and then punching straight in. So you can try that a couple times with nice firm punches with really good control, using that non-dominant arm. And we're actually using even our legs a little bit to give us a little more power in the punch. Our whole body should be involved. Then let's try with the dominant hand. Same punch coming across for a hook. And you want to make sure to breathe. So we kind of do an exhale as you're punching. Then we're light on our feet, hands are up. We've got an uppercut. So we're going to bring that non-dominant arm under and use our legs to kind of sweep under and come up. Sweep under and come up. So try that on the non-dominant side a few times. And then try on the dominant side. One more, very good. And then light on your feet, hands up. Try to just stay nice and bouncy, keep breathing. Let's go through and do those punches in order, in the row. So a jab, non-dominant hand straight forward, cross, hook, hook, uppercut, uppercut. One more time, jab, cross, hook, hook, uppercut, uppercut, and lay it on your feet. Very nice. Whew. Okay, feel free to shake it out a little bit. We're gonna keep that movement break a little brief just because we were running just a few minutes behind schedule. So hopefully, I actually did get my heart rate up, even though that wasn't very long. So hopefully all of you got your heart rate up a little bit, moved around. Feel free to walk around your space if you want to. A couple things about boxing. So if you are going to in-person classes, there's lots of fun equipment, heavy bags, speed bags, different types of boxing bags. Usually classes also incorporate agility exercises and balance and core work and warm-ups and sometimes voice. So there's lots of different things that are included. And even if you feel like, I'm not a fighter, I'm a lover, not a fighter, I would suggest still trying boxing. You may really surprise yourself in how much you enjoy it. I think there's a lot of really strong kind of the emotional component of feeling strong and powerful and fighting back. So that is really a great part about boxing as well. And then another thing I love is that we can really challenge cognition. So we want to be very aware of cognitive health as well, keeping our memory strong, our attention, our problem solving, along with our physical health. So boxing really lends itself to working on combinations. We did jab, cross, hook. What if we did a jab, hook, jab, cross? So we have different patterns we can do where we're working on memory and processing and speed of movement and reaction time. So there's so many good things that we can work on. In-person classes will often include equipment, but we have classes online for boxing. You don't have to have the equipment at home. You can do a boxing workout from home. It's more shadow boxing like we were just doing, but it still can be a really great workout. So boxing is one of the forms of exercise that we highly encourage you to try if you haven't already. If anybody has tried boxing and has anything that they want to share, feel free to put that in the chat. And I am going to turn it over to Lauren because she is a fighter. She is a boxer. And so she can share a little bit about her experience with boxing.
Thanks, Claire. Just real briefly, because I know we're running short on time. I started boxing very quickly after my diagnosis. I had never boxed in my life. It was nothing that I wanted to do. I was extremely intimidated. A year later, I got certified to be a boxing coach. It has done so much for me, and it's not just the physical part of it, but it's the emotional. It's empowering. It gave me my confidence back, gave me flexibility. It helps my balance. We work on our voice. We do a lot of, we might be yelling jab, cross while we're yelling while we're doing the punches. Like Claire said, it's got a cognitive component to it, and the social component to it is a huge part of it. It's like a big family, and we support each other. We laugh with each other. We cry with each other. There's Rocksteady boxing programs all over the world, actually. I put in the chat the International Rocksteady website where you can find classes. And if you have any questions about it, I'll put my email in the chat. Feel free to ask me. I'm a huge proponent of it because it's helped me so much. So one of my fellow boxers is our next speaker. We have Dave Orlowski up next. Dave is a person with Parkinson's, and he is one of those people that has been very successful living well with Parkinson's for a really long time. So I'll pass it over to you, Dave.
Thank you, Lauren. Good afternoon, everybody. As Lauren said, my name is Dave, and it has been 22 years since I was officially diagnosed with Parkinson's. That was in 1999, and I was 42 years old. Clinton was still president, Y2K was threatening to blow up our computer systems, and Tom Brady was still a year away from entering the NFL. And so I'd like to share a few highlights and observations from my journey. My life prior to PD was right on track. I had a great family, a good job, and a nice house. I was also a competitive distance runner and swimmer, did numerous triathlons, and was just very active in general.
We have
But then in my late 30s, a slight tremor in my left hand appeared that eventually was eventually diagnosed with Parkinson's a few years later when I was 42. At that point, I had no clue what to do, so I basically did nothing. Michael J. Fox had only recently disclosed his Parkinson's diagnosis in November of 1998. And at that time, very little was spoken publicly about Parkinson's, and there were very few resources available compared to today. So after my diagnosis, I continued to work, but did not disclose anything to my employer. I also started keeping a lower profile at work, hoping that nobody would ask any questions. Over time, this would cause me to miss out on some good career opportunities as well. I also tried to maintain a stable family life, and I only told anyone of my diagnosis when necessary. I did continue working out though and stayed as fit as I could. I took my medication and went to my neurology appointments, but otherwise I had no interaction with the PD world and had no interest whatsoever in joining a support group. And it went on like this for about 8 or 9 years. And I would later realize that by not disclosing it, I really was not fooling anyone but myself. Then it all began to change when my neurologist at the time asked me to tell my story to a Parkinson's boot camp session in San Diego. That day, amazingly, was also the first time I had knowingly ever even spoken to another person with Parkinson's. And it was then that I realized the need to speak to other people with PD. So soon after, I joined my first support group down in San Diego. And thanks largely to that group, I overcame my denial of having Parkinson's. I had finally felt at ease being among others with the same issues that I had been dealing with for years. That group later closed, but by then I had at least realized the benefits of a good support group. And then about a year later, which at that point was 10 years after my original diagnosis and of going to work with PD, I got laid off from my job where I had worked for the previous 23 years. I had dreaded getting laid off because I knew I would probably have difficulty getting hired anywhere else. And that would prove to be true. So I started my own online software consulting business instead of looking for another job. I was enjoying working for myself and hoped that I could continue doing so until retirement age. And then after a few years in business, I also joined a new support group, a small one I found down here in Orange County. And after 7 years of working for myself, I had gone from working full-time to working what felt like all the time due to advancing PD symptoms. By this time, I had managed to work 17 total years since my diagnosis, and I realized that it was now time to move on. So I slowly dissolved my business and refocused my priorities on dealing with my Parkinson's, and also on the support group, because somehow over time I had become the group's facilitator, and along with some amazing people, that small group eventually grew into a much larger group, and we have been growing and going strong ever since. I would like to think that after more than 22 years of living relatively well with Parkinson's, that I must be doing something right. Working with my doctors over time to determine the optimal combination of medications has certainly been important. An improved diet has also been a benefit, though I'm still working on that one. But there are two other factors that have also been very important to me. The working out and socialization. Undoubtedly, my overall consistency with working out has been a positive factor for me. I also follow the theory that says exercise in moderation is the key to success. I've had success from activities such as boxing, running, walking, spin cycling, yoga, weight training, and ballroom dancing, actually. Some workouts I do on my own and some in a group setting. They're especially effective in helping me to maintain mobility, stamina, balance, and coordination. I was also doing boxing workouts with Rocksteady before the pandemic. I hope to resume that soon. I highly recommend looking into that if you haven't already. There are countless other fun activities you can do as well. It's just important to stay active and keep moving. Someone recently asked me what my biggest challenge with PD currently is and how I work through it. And I replied that at this point, my biggest challenge is simply maintaining the drive that keeps me going from day to day and year to year. There is no pill or specific exercise for that. And how I work through it is in large part thanks to the other factor, socialization, provided by my support system. Socialization settings such as boxing or yoga class, or a support group meeting, going for a group walk, or just meeting someone for lunch. Interacting with others with PD encourages me to maintain perspective and gives me the will to go forward. My friend Lauren here calls them her peeps, and my friend Allison calls them her wolf pack. I just call them my friends. But regardless of what you call them, the more you communicate with other people in your situation, the easier it becomes to focus on what you need to do to live well with PD. Parkinson's has certainly altered the course of my life. Accepting the disruptions in your life when you get Parkinson's at a young age is difficult. It's also very costly financially for me and forced me to make some decisions earlier on in life than I normally would have had to do. There have been some low points and some humbling moments, such as knowing that my daughter, who was young at the time of my diagnosis, would never remember what I was like before Parkinson's. She will only remember the PD version of me. However, with that said, life with PD has also provided me with many high points in its own way that I will always treasure. There have been many special memories and accomplishments that I am proud of. But by far the best thing that has come from having PD is that it has given me the honor to meet some remarkably interesting and courageous people who fight Parkinson's daily, as well as others who are care partners and still others who just care. And I would not trade knowing these people for anything. So please consider joining a support group if you haven't already, whether you or someone you love has PD. And if you don't like the one you join, try another one. There are different group formats, so search for one that meets your needs. The Zoom meetings that we have gotten used to this past year will continue, but it is safe. But once it is safe to do so, try, if you are able, to attend an in-person support group meeting as well. You will find it very enlightening. You will likely meet some amazing people along the way too. These 20 plus years have been far better than I ever would have imagined after the heartbreak I felt on the day of my original diagnosis. There are plenty of things you can do to live a long and happy life with PD, and you do not have to do it all by yourself, as I tried to do for so long. And remember that it's okay to have a bad day and it's okay to cry, but it's also important to keep a sense of humor and to laugh when you can too. And I'll close with a quote by Michael J. Fox, who said, "I do not have a choice whether or not I have Parkinson's, but I have nothing but choices about how I react to it." Thank you. Back to Lauren.
Thanks, Dave. I just have to tell everybody, Dave can really wail on those bags at the gym, and he holds the record at our gym for the longest plank, which I think is like 7.5 minutes, Dave, am I right?
Yeah, 7:15.
Yeah, close enough. He's a beast in the gym. He does a really great job. So our next speaker coming up is Renee Lorch. Renee is a licensed marriage and family therapist in Orange County. She works with a variety of clients, and her passion is working with people with Parkinson's disease. She co-facilitates a Care Partners support group here in South Orange County. And she does provide individual and family therapy through her practice at Sage Holistic Health and Wellness Center in Tustin. Renee's understanding of the disease paired with her training and experience in mental health has allowed her to create a special niche within the Parkinson's community. And she's going to share with you the importance of taking care of your mental health, not just for people with Parkinson's, but for their loved ones as well, which is really important. So welcome, Renee. It's so good to see you.
Oh, good to see you. Thank you, Lauren. Hello, everyone. I know that mental health is probably not the most popular topic when your neurologist gives you a diagnosis, I know that it's encouraged to form a care team, and usually that looks like physical therapists or speech therapists, occupational therapists, but I really feel like there should be more of an emphasis on the mental health component. And I feel very fortunate that through my experience, I have been able to work with both the person with Parkinson's as well as their care partner. And it's really given me kind of tools to help both from both perspectives. And so I think that's where my passion has come from. But and I might be biased, but I think that everybody should go to therapy at some point or another. And there's always this misconception with therapy that it means you're sick or you're weak. I know with the older generation, it's therapy's, not something that was always welcomed or discussed. So, but I really see therapy differently. I see it as a way to strengthen or a way to grow, or just especially somebody who is going through this journey of Parkinson's, just increasing insight and understanding of these different transitions and changes. And so, I really I could talk all day about the benefits of mental health, but for the sake of time, I'm just going to try to narrow down a little about the importance of taking care of your mental and emotional well-being, whether you have been diagnosed with Parkinson's or you are caring for someone or have a loved one who has been diagnosed with Parkinson's. So, we all know the saying that you are what you eat, but as a therapist, I like to use the phrase, you are what you think. And so our behavior and our mood are significantly controlled by our thoughts. So if our thoughts are self-defeating, I can't do this, then our behavior is going to show up in a way that, where maybe I don't need to go to physical therapy. It's not going to help because, I just can't do it. Or, our behavior is really driven by our thoughts. And so I think that there is an emphasis on exercising and diet for those with Parkinson's, but sometimes those negative thoughts can get in the way of our motivation, and it can impact relationships, and unfortunately it can manifest into all kinds of symptoms. So I know there was a question about somebody had asked if anxiety or depression can impact symptoms. Absolutely. And part of going to therapy is really understanding those thoughts and how they might be getting in the way of our motivation or our self-esteem. And so why therapy? So statistically, a person who's been diagnosed with Parkinson's has about a 50% chance of developing symptoms of either depression, anxiety, or both. And the same goes for the identified care partner. There's an increased chance of anxiety, depression, overwhelm, burnout, all of that. So therapy is a really good place to really just lay it all out. And therapy looks different for a lot of my clients. I feel like I personally have a different approach than a lot of therapists, because I allow my client to just it is what they need it to be. So sometimes it's really just getting the emotions out and having a safe place to just say things that they couldn't tell, they'd be embarrassed to tell their family, or maybe feeling guilty that they're feeling stressed or depressed or anxious. So really just giving my clients that freedom and a safe place to just say whatever they want. And trust me, I've heard it all. And I can really see just that process of being able to, judgment free, just say whatever. I can see it coming off that like a ton of bricks, just that, their mood changes, their posture changes, just by being able to get it out. And sometimes people don't want to burden their families or their friends with whatever. They feel like it's not like, oh, I don't want to tell my friends. They're sick of hearing about how stressed I am. And so therapy is a really good place for that, because that's what they're there for. And another reason that where therapy can help is our emotions, when they don't have anywhere to go, they can get stuck in the body. And so they'll get trapped in the body, and they can manifest in all kinds of different ways, such as fatigue. It can affect appetite, it gives stomach problems, GI problems, sleep. Did I say sleep? Headaches, backaches, brain fog. I don't know if it's known, but a symptom of depression is memory, not memory loss, but impaired cognition. So if we have symptoms of depression, if we have depression, it can create some brain fog or cognitive impairment. And so that can give us that brain fog, or that just feeling disorganized and things like that. So another way I know, especially for, maybe going to therapy and people who aren't so comfortable about talking about their emotions and their thoughts and their feelings, which I totally understand that it sounds very off-putting to a lot of people to talk about feelings. And but for a lot of my sessions, sometimes it is just, process, like perspective shifting, helping, because with a diagnosis, it is going to change some of the roles and dynamics of relationships. And so because I do have the experience with both the person with Parkinson's and the care partners, I really learned from my clients I've learned so I can help my clients to increase awareness and be able to provide some perspective shifting and that kind of sense of putting yourself into your loved one's shoes. And honestly, that I get a lot of positive feedback just from being able to have a place to slow down and to be able to have that, increased, or just work on that empathy, or the ability to understand what the other person's going through, instead of being quick to feel like I don't know, like they're mad at me, or they're instead of taking things so personally, I guess is what I'm trying to say. So and it's also a really good place for psychoeducation. And because I have, through my professional experience as a therapist, I've been really fortunate to work under psychologists and neurologists and psychiatrists and different professionals who do focus on different areas, like with like Parkinson's or Alzheimer's, dementia. All of those different parts have helped me to understand more of the progression of the diagnosis itself, and the progression, and the motor and the non-motor symptoms. And so that has really helped increase my understanding. And I am in no means, I'm not a neurologist. That is outside of my scope of practice to talk about it medically, but it does help that I understand. And so meeting with a therapist who understands both the mental health part as well as the movement part, the non-motor and the motor parts that come with Parkinson's, is really helpful for some of my clients to just talk about it, because like we were mentioning earlier, neurologists are there to help, but sometimes they're not always, we don't always have, or we don't feel comfortable. So meeting with a therapist weekly could just serve as that place to just sit and talk and increase awareness of the diagnosis. And
can I ask you a question?
Yeah.
I think a lot of people think of seeing a counselor possibly when they're a little bit further along into their Parkinson's and they're having some more issues.
Mm-hmm.
I kind of think of it a little differently, like possibly for not just the person with Parkinson's, but for the caregivers as well, seeing someone and talking to them at the beginning of the diagnosis. Can you share your thoughts on that?
No, yeah, actually, that's a point I definitely want to make, because I do work with people. whether it's in a group setting or individual, the person's been diagnosed or the care partners, either. I work with so many, it's hard to kind of capture all that in one thought, but early intervention is always going to be key for anything, because if, even though you're not, and I have noticed where group settings, sometimes people who are in the earlier stages find it overwhelming to be sitting next to somebody with dealing with the later progression of the disease. So individual sessions are really good at that, to be able to focus on the here and the now, and to develop the skills to not create this anxiety. What I always say is we cannot create the ending of a story before it's even begun. And that happens a lot. Well, I know Joe, who has Parkinson's, and he had these and these and these symptoms, and this happened. And I know, my brother had it. And we hear all these stories, and then we try to attach it to our own. And so really, a lot of the things I do is keeping my clients present, because we do tend to get ahead of ourselves. And so early intervention is a really good way of kind of working that out before it gets to the point where we go through these big transitions. And if we feel better emotionally, then these transitions are going to be a lot easier for everybody involved. And so definitely early intervention and helping to stay present, because we tend to compare. We tend to get anxious about the things that we don't have control or we don't understand. So it doesn't matter what stage or what at all. It's early intervention for anything is key. So definitely therapy is, I always wish neurologists would just have, maybe it's just a dream of mine, neurologists to have a therapist on staff and say, this is your first step. I'd like for you to go to a therapist to be able to talk about this early on, because I think it is important. And there's so much information out there that I think we tend to get carried away. So a therapist is a good place to help ground you a little bit.
Renee, someone asked, because we have a lot of people on here who are not local to Orange County, how would they go about finding someone in their area? And let's see, the question says mental health availability and the name, or where to find it there, where to find you. Outside the area also.
Yeah, well, I was going to say, actually, PD Buzz is a really good resource, because Lauren's really good about posting the different support groups. And then I know there are some mental health providers on there. I can link my information below. I'm located in Orange County, but it is something that it is hard to find a professional a therapist who does specialize in Parkinson's but I think the first step would probably be to go to just a local Parkinson's association, or I'm so happy to help. If anybody would like to reach out, I'm happy to reach out to my resources in the therapy, or the different communities that might be helpful, because I have actually done some work trying to find different therapists that specialize in this, and it's not easy. So
are you doing virtual sessions?
I do virtual sessions. I'm licensed in California. I'm working on getting licensed in West Virginia. And I'm actually working on getting licensed in other states, because I just feel like it is important to the community when I try to do research and it's hard to find. So I am actually going to start a kind of, a national support group. So that doesn't really have ties to any location, whether it's East Coast, West Coast, and it wouldn't be using my therapeutic hat. It'd be a support group. So I'm happy to share that when that's up and running as well. But I think the benefit of Zoom is there are more opportunities to find a support group virtually, but I'm definitely happy to help connect whatever state you're in. I'm definitely happy to connect you or to try to connect you with somebody who has experience in that area.
And Renee helps co-facilitate a couple of support groups here in Orange County, but they're virtual. They're for care partners. So they're virtual. Yes. So you could access that from anywhere.
Yeah, that's true. And the care that those are so helpful. I think when we think about self-care, we think about, doing, like, I don't know, I just think of like pampering, like manicure or pedicure, or just something where we feel like we have to do something. But honestly, those support groups are a really good way to add that self-care into a routine, whether, no matter what the experience is just connecting. Research shows that there's so much benefit of support groups because it's really just normalizing your experience. I always tell my clients, if you're sitting home alone and you feel like you're always going to feel like you're the worst in the room, you're going to think, oh, well, nobody knows what it's like to feel like this. And it is going to really reinforce those negative thought patterns. So being in a group with people who are encouraging and inspiring and motivating, and especially the South Orange County care partner groups that I'm co-facilitating, there's so much love in that group. And I know that support groups can feel like, oh, it's just heavy and these groups are so beautiful. I love showing up every week because I just see how the support and just normalizing this journey with each other has really helped them to just dedicate that 1 hour every other week to just, to being present and showing up for themselves. And so there's so much beautiful just benefits of connecting with others.
Yeah, I always say self-care is not selfish.
Yeah. And as a care partner, we can't, I think there was the gas tank metaphor that was used earlier, and we have to be able to fill our own cup. We have to be able to fill our own tank before we can help others. And that's why it's not selfish. We can't give somebody love and attention and good care if we're not doing that to ourselves. And so, it's a really good way to just, and even to connect with different resources. A lot of times these groups are sharing resources. And I always write down notes. If I hear a good tip, I always write them down so I can keep them, if it comes up. So it's a really good way to spread resources too. And so I know, there are a couple of questions too about sleep, and I think a lot of times just talking about, I know with Parkinson's, the last thing that anybody wants or needs is another pill added to the regimen. And so I like to see therapy as a way to kind of to try to create different ways to intervene that could help, whether it's, writing down your thoughts so your anxiety doesn't keep you up at night, or the use of the weighted blanket has actually been a really popular theme lately with a lot of my clients, just working on something that doesn't add another pill to the regimen. And so that's what I love about therapy, because it helps to just kind of lighten the load, and it helps to get those emotions out of the body, so they're not creating any problems extra problems that we don't need. So I think that's basically it. I just, I think therapy is something that I wish that the neurologist emphasized a little more, because I know therapy can seem a little daunting or scary or boring or whatever, but I know my job as a therapist, I feel like it's important to make sure therapy is not boring. So, and I enjoy it. I'm really passionate about it. So I encourage you all, if you feel like, even if you don't feel like your symptoms connect with depression or anxiety, it's just like an oil change. It's just maintenance. And it's always a good idea to take care of your emotional and mental needs, so it can help you to be stronger in the gym and feel motivated.
I put your website, the Sage Wellness site, in the chat, Renee, so that if
Yes.
people can contact you, they can reach you there. That's the best way?
Let me write my actual, because that'll go to like the generic, or like the, so it's just Renee. Oops, there we go. That's my email. And feel free to reach out anytime. I love just being able to provide resources or support in any way I can. So please don't hesitate if you ever have any questions.
And I don't know if you sent the email. I don't see it. So I don't know if it maybe went to a direct message to
it did. Oh, thank you.
Group. So yeah, if you could send that to the whole group. And yeah, I just want to echo all of that. I think that mental health care should be part of primary health care and certainly should be something that is made available to everyone. You know, just being diagnosed with a serious health condition that is going to affect your life is, even if you don't feel, you know, depression per se, just, you know, kind of coming to terms with the diagnosis and how you can live the best life possible with any diagnosis, which is absolutely so possible for Parkinson's. But I think just that transition, coming to kind of terms with what that diagnosis means, how to move forward. And then I know, like, when I went to therapy, I actually went at a time in my life where things were going pretty well. And my decision was, you know, I want to work with a therapist now to kind of make sure that my life is the best it possibly can be and have kind of a working relationship with someone so that if things get tough, I have someone to call on. You know, like, don't wait for things to be bad to, you know, to access therapy. It's like with physical therapy and exercise. You know, we tell people, don't wait until you have a problem to start exercising. You want to start early. So I would say same thing with mental health care. You know, don't wait until it feels like you have to go now. Maybe it's, you need a couple sessions and you kind of just talk through some things and you get yourself in a good place where you can really take care of yourself and you know what to watch out for. And then have someone that if things do get tough, you know, okay, I can now access that person to work through this challenging situation of something that has come up. So again, you know, we just really want to think more about prevention for kind of all aspects of the care that you access and receive related to Parkinson's. So I just want to echo everything you said, Renee, and just encourage people. And going to therapy doesn't mean you're making some like long-term commitment to having to go every week. You use it as needed. Some people probably go weekly. Some people might need more than that if they're, you know, if there's kind of a crisis. Some people may just have a check-in every once in a while. So that's one thing I think we can also help is just to talk about the different ways that this can look for different people. And a lot of times people just think, oh, you know, if I go to this, I'm going to have to commit to something on a long-term basis. And it's very, you know, flexible in what you need at that time.
Yeah. And I think too, when we're in a state of crisis, the last thing we want to do is look for a therapist that, or any professional that we kind of impulsively. It's better to go when we're feeling calmer and we can kind of not feel like we're rushed to find somebody just for the sake of finding somebody, because just like any doctor, if you find somebody and it's not a good connection, then you don't have to continue. So going at a time where you don't feel like you're in crisis and you can make that, you know, build rapport and make that connection is a way. It's a better way to kind of go into treatment or, you know, to therapy, because last thing you want to do is be in crisis mode and have a therapist you don't connect with, because then you're going to say, well, therapy didn't work. I don't want to do that again. So doing it before, like proactively, is definitely they're positive, more positives than for sure.
All right. Thank you so much, Renee, for being with us today. And her contact information is in the chat for anyone who would like to reach out to her directly. And so questions about insurance, and maybe you can answer that in the chat, Renee, because that is, I mean, for all therapies, physical therapy, and then definitely mental health, that there isn't always the best coverage through insurance. So that's a whole kind of another topic area. So I will let you answer some in the chat, and then maybe, you know, an email or conversation with Renee will help to kind of figure that out. And we will continue on our schedule. So I will remove Lauren. So next person we have coming to share some information is another Lauren. She is a representative of Parkinson Foundation, which is one of the national organizations in the US. And there actually are, I believe, chapters and even outreach in other countries as well, but especially they do have a lot of activity in the US. And I do just want to mention, as Lauren comes on, she's going to share a little bit of some of the projects and initiatives that the Parkinson Foundation has going now. But she and I actually recorded a video that ended up being it was like 40 minutes long. We recorded about a week ago and sent that out ahead of time for anyone who had registered in advance of that. If you did not see that video, we will be sending the link to that again so that you can watch it to get more details and more information about the Parkinson Foundation. Although they are a national organization, they do a lot locally. So they're a great one to look out for and connect with. And so Lauren's going to share a little bit here. And Lauren, I did make screen sharing available, so you should be able to share those slides. And thank you so much for being here, Lauren.
Thank you so much for having me. I am honored to be a part of all of the many experts that you are having speak today. Can everybody hear me okay just before I get too deep? Okay, great. So I'll go ahead and share my screen. And before I do that, in the chat box, I'm going to go ahead and put my information. I have my email address and my phone number. As Claire mentioned, I am located here in Orange County on behalf of the Parkinson's Foundation, but we are a national organization. So I know there are people on this call that are not in Orange County. You can still reach out to me and I would be happy to connect you to a foundation staff who is local to you or help connect you with whatever resources you're looking for. We also do have our helpline number that I will put in there as well. It is 1-800-4PD-INFO. So if you have any questions and are not going to reach out to me, or it's something more specific to your area, you can always reach our helpline as well. So I'll go ahead and share my screen now. Can someone give me a thumbs up if you can see? Okay, great. Thanks, Claire. Okay, so again, here's my contact information. And for those of you that don't know, the Parkinson's Foundation is a national 501c3 nonprofit. We are across the United States and in 8 international locations as well. Our mission is to make life better for people with Parkinson's disease by improving care and advancing research toward a cure. So yes, we invest in research and studies toward a cure, but we also really heavily focus on improving the quality of life for people who are currently living with Parkinson's disease while we are still searching for that cure. So the ways that we want to do that is we want to improve care for everybody that is having has Parkinson's, advance research toward a cure, and help empower and educate the global Parkinson's community. So what a lot of others have already mentioned on this call today. Some of the ways that we can help support people who have Parkinson's and their community of care partners is through local events. I'll talk about those in a little bit, our community events. We also host local educational programs. So similar to what you are partaking in today, the Parkinson's Foundation puts these on too. A few times a year in different locations, we will have topic-specific educational seminars that we have expert speakers come join us at. So keep an eye out because those are very frequently happening and are always free to attend. Right now, they are being held via Zoom, but in non-COVID times, we do gather in person for these. We have a PD Health at Home series that you can find on our website at parkinson.org. Our PD Health at Home series started during COVID, but has extended and will probably continue on past that because it has been so well received. We do mindfulness Mondays, wellness Wednesdays, and fitness Fridays. We also have expert briefings that you can find online, a podcast called Substantial Matters. We do training programs to help support our local medical facilities, and we provide community grants to help fund local programs. Claire and Rogue is actually a recipient of one of our community grants. So we really use those to try to invest in local programs and help create and deepen the impact of things that are currently happening or help implement new things to fill gaps that are not currently being covered. Another huge thing is our resources and our kits. So what you see in the middle of the screen here, these books, The Caring and Coping, Mood and Cognition. that is just a small sample of the many different topic-specific books that we have. Because everybody's Parkinson's symptoms look very different, nobody experiences the same exact things. These are meant to be able to serve what is most important to you and what you need to have more information on specifically. So, while somebody might want to learn more about cognition, another person might want to learn more about medications. We also have other topics like fitness and managing Parkinson's mid-stride once you are kind of past the initial newly diagnosed stage. So these are all available for free. You can order them via our website or our 800 number that I put in the chat previously. You can also reach out to me and I'd be happy to help get any of these sent to you. A full list of the books is available on our website. If you go to parkinson.org and then to the Living with Parkinson's tab, you'll be able to find our PD library. These are really wonderful tools and they are really easily digested. They're not written in very complicated medical terms. So we're really excited to offer these. We also offer them in multiple languages. Over on the right of that, you'll see this little black case that's called Aware in Care. This is a hospitalization kit. Our studies showed that 3 out of 4 people with Parkinson's disease, if they entered the hospital, they were not receiving their medications on time. And when I say entered the hospital, I mean for anything, whether that is Parkinson's related or not. So even for people going in for an elective procedure, we recommend having one of these hospitalization kits. It comes with a medical bracelet and an informational pad about what medications are able to be taken in conjunction with your Parkinson's medications, what should be avoided. And it also has a medication log so that you can track when you are getting your medication to help ensure that you are actually receiving it on time. This is an extremely useful kit and we highly recommend everyone having one. This is also something that we offer free of charge and you can order that online via the helpline or you can let me know and I'd be happy to help get one for you. I'm seeing the little chat button light up, but I'll check that at the end of this and answer questions. So I'm not going back and forth. So now this is another initiative that we launched probably about 12 to 18 months ago, and it is specifically for reaching newly diagnosed. So this newly diagnosed kit is really about helping people navigate the very beginning stages of learning that you have Parkinson's disease or that a loved one has Parkinson's disease, and helping try to take away a little bit of the fear of the unknown and a little bit of the not knowing what you don't know. So this kit comes with a letter from somebody who has Parkinson's disease, a fact sheet about PD, 5 steps to living better with PD, some information on how you can get some of the previously mentioned resources from the foundation, and some suggested key questions for your doctor. So this kit is available at parkinson.org/newly diagnosed. You can download it there digitally, or you can request a free hard copy. We are really working on getting these into different medical facilities so that it starts to become the norm for everybody to receive one of these with their diagnosis. But until then, we are just trying to reach as many people as we can via word of mouth and groups like this, and let them know that, you know, even though that new diagnosis can feel really scary and overwhelming, there are people and organizations and information to help you navigate those beginning months and years. Another really exciting thing that we have recently launched is a study called PD Generation, and it is the first of its kind, and it's available nationally, and it is where we are offering free genetic testing and counseling to anybody who has Parkinson's disease that wants to participate. The idea behind this is to help better understand both for the person that has Parkinson's disease to know whether or not there is a genetic component involved in your Parkinson's diagnosis, and for researchers to help understand more about what genetic markers could lead to a higher likelihood of developing Parkinson's disease, and to understanding the different types of Parkinson's disease that affect different people. So you may have heard of studies like 23andMe. This is similar to that. However, it goes beyond that. It searches and identifies more genetic markers than the 23andMe. And the really important thing too is that it comes with counseling. So with something like 23andMe, you usually just get those results, but where does that leave you? You'll probably have a lot of questions about understanding that and what it could mean. With our PD generation study, you will get counseling along with your genetic results. So you'll have somebody to help you understand the results that you're looking at and what that may or may not mean for your family. A lot of people with Parkinson's want to know if this is something that may affect their children or grandchildren. And this can really help you understand whether or not that may be the case in your scenario. We know that not all Parkinson's is genetic, but we do know that some people with Parkinson's might have been at a higher risk of developing their disease because of a genetic component. More information about this can be found at parkinson.org/PDgeneration. It's spelled like generation. And the really great thing too is that we just recently, in the last handful of months, announced that you can enroll from home. You used to have to go in person, and the closest in-person enrollment site was UC San Diego. Now you are able to do it from the comfort of your own home. We mail you an enrollment kit and your intake form, and you fill all of that out. It's very simple and very easy. So again, parkinson.org/PDgeneration, or again, you can always reach out to me or call our helpline. So the last part that I will share with you today is about our local events. As you heard from Dr. Bixby and Claire and Dave, and probably anyone else that you talk to about Parkinson's, movement is just so critical and so key for helping live your best life with this disease. So the Parkinson's Foundation is absolutely a proponent of movement, exercise, and fitness. So our signature event is called Moving Day, and it is all about making sure that we are staying active and getting our movement in daily. Typically, Moving Day is a community event where we gather somewhere locally, and it's an afternoon that it consists of a 5K walk or shorter for those that need shorter, and a lot of resource providers coming together to share information about their organization, our medical facility, or pharmaceutical company that serves the Parkinson's community and what they can help and do for you. There's music, there's booths, there's all of these things. This year, of course, it's looking a bit different. This year, we still wanted to make sure we're highlighting the movement aspect. So every weekend until May 22nd, we will be doing a walking group. We send out announcements about the coming weekend on Monday or Tuesday to share where we will be walking and where we will meet. I try to change locations to make sure that at least one weekend will be near different areas of Orange County. We actually were just out walking this morning, and we walked for about 45 minutes, and you can track your steps in our Moving Day app and earn different rewards and prizes for different amounts of steps that you complete. We're also going to be having a virtual event. So this picture that you see in the middle here with the purple is a little bit what our moving day event will look like. And you'll be able to click into different booths. There'll be an exercise booth, so you can click into there and watch different exercise videos and participate in that. You will be able to hear from different speakers, and you'll be able to live chat with our sponsors and our resource providers. We'll also be doing a little bit of, the virtual event is on May 22nd. And then we'll be doing a little bit of a drive-through option too, for people to come out and pick up their prizes that they've earned and see some people safely in person as well. So we do this every year. It's not just in Orange County. If you are tuning in from another location, you can find a moving day near you or participate virtually in whatever event you are closest to. For Orange County, you can visit movingdayorangecounty.org. If you are not in Orange County, you can visit movingdaywalk.org and put in your zip code to find one that is close to you. And lastly, we also have a new event called Parkinson's Revolution. This is also about movement and exercise, but we wanted to offer another way for people to do that, and that is through cycling. So these are on stationary bikes, very similar to a spin class at a spin studio. We'll be having this on Saturday, June 12th at Moxie Studios in Costa Mesa. It will be outdoors and COVID safe under a tent. And people of any cycling skill level are welcome to participate. You don't have to be somebody who regularly attends spin classes. It's just a way to come out and get another form of movement and exercise and be with part of the Parkinson's community while you're doing that. So you can find more information for this one at pdrevolutionoc.org. Again, this will also be offered virtually as well as in person, so you don't need to be in Orange County to participate in this one either. The last slide I have, I'll just leave up for a moment. If anybody wants to jot down my contact information, it's at the bottom. Our helpline number and email address, as well as our California chapter Facebook and section of our national website. We do have a California chapter, which means that, you know, wherever you are in California, there is probably a local event happening for you. Anyone anywhere else can also look up your chapter location as well. And now I will stop sharing and see if I can look at the chat box. Oh, it was Lauren being so wonderful and sharing our information. Thank you, Lauren, for keeping up on that. Is PD Generation 4 Canadians too? You know, I would direct you to our helpline to find out. I believe that we are offering it in some select locations outside of the US. So if you call 1-800-4PD-INFO, they can let you know, or Maureen, if you would like to email me, I would be happy to find that out for you and find out specifically where in Canada you are and whether or not we'd be able to mail you one of our home enrollment kits. So I don't know if anybody had any other questions, but thank you guys so much. And I know I kind of moved quickly through that. But as Claire mentioned, we did have a longer conversation where you could get more details on a few of the things that I touched on. I'm also always more than happy to email with any of you or have a phone conversation with any of you. The foundation has so many wonderful resources that I would be happy to share and walk through or get sent to you.
Thank you so much, Lauren, for being here and sharing all of that. And Parkinson's Foundation does so many great things. So definitely a resource that you want to check out.
Thank you.
Great. Thank you. I will. Okay, so it is time. We're running a little bit behind, which started all the way from Dr. Bixby and the fact that we didn't want to let her go. I didn't want to let her go either. I had to really inhibit the desire to ask her more questions. But we're running a couple minutes late. So I'm going to try to get us back on track because we just have a few things left for today. Everything we're doing, we believe is helpful and important and useful. So we don't want to waste anybody's time, but we do want to get to everyone we have coming up. So we're going to do a quick movement break. So basically, again, if you need to use the restroom because you've been doing a great job drinking water, please go use the restroom, refill your water. And then if you want to do a little stretching and movement with me, we're going to jump right in and do that. The set of exercises we're going to do now are some of the power moves. Power moves are exercises that were developed specifically for people with Parkinson's to address some of the changes that tend to occur. Different, profiles for different people. Some people experience certain changes and not others. But these exercises are really good no matter what. And actually, we have quite a few spouses and my mother, people who don't have Parkinson's that do the power moves and also love them. They're really just great stretches and mobility exercises and very different than boxing. And that's something else I would really encourage everyone to do is have kind of a variety of types of exercise you do. None of us really should just be doing one thing all the time, every day, or just multiple times a week. It's really good to have a variety of exercise that you do, different intensity levels, different types of exercise. So the power moves I think of as more moderate intensity, more stretching, more mobility focused. So let's go ahead and do them. So if you're sitting in a chair, we are going to start in sitting. Just go ahead and push yourself back from your chair. I am going to come into my chair right here. So we want to scoot forward in our chair. So you're sitting towards the front edge and then bring those legs wide apart. You may already feel some stretching or some activation in your hips. That's a little bit different than usual just by opening up your hips. We're going to have our hands on our hips. We are going to stretch forward through your hips, using your hands to support, and that should feel good. Even though we've been sitting, stretching more actually feels really good. And then we're going to sit up tall and open up through our arms, stretch your arms back. This is called a power up for posture. So take a deep breath in and out, and then let's go again, down and up. 2, we're going to get into a nice rhythm. Down and up. 3, down and up. 4, down and up. 5, down and up. 6, down and up. 7, down and up. 8, down and up. 9, down and up. 10. Very nice. So that should help you be able to sit up and stand up taller. Posture is one of the things that can change with Parkinson's. We want to make sure to work on it through flexibility, exercises, and enough repetition, because our goal is not only to stretch the muscles, but to retrain our brain for bigger and better movements. So next is our rock and reach. Feet are still wide apart. We're going to put our right arm down on our thigh. I'll mirror you for these ones. Then lift your left arm up towards the ceiling, maybe even over your head, so you feel a nice stretch down the side of your body. That's 1. Switch other side, reach up and over. That's 2. Switch. 3. Again, we'll get in a nice rhythm. 4. Oh, it feels pretty good to me. 5, 6, 7, 8, 9, and 10. Usually we'd actually do 20 of these, but for time's sake, we'll do a little briefer exercise round. So feet are wide apart. Next exercise is the twist, which is to work on trunk flexibility and rotation, which really helps decrease stiffness in the back and in the neck and helps us be able to move easier and more efficiently throughout the day. So we're going to bring our arms out to the side. We're going to take our right arm and reach across, hands together, point that knee down, stretch over to the side. Hold for a moment, and then we're going to open big in the middle, really stretch those arms open, then left arm and leg across. That's 2. Open, we'll go a little faster. 3, open. 4, open. 5, open. 6, open. 7, open. 8, open. 9, open. 10, and open. Very good. Bring those legs in, about hip width apart. The next one is the step to really loosen up through our hips and make it easier to move and stand up from a table or get in and out of a car, things like that. So take that right leg, lift that leg up and over to the side, sitting up tall, and then a big step back together, and then left side, big step up and out to the side, and back together. That's 2. Right side, 3. Together. 4. Together. 5. Together. 6. Together. 7. Together. 8. Together. 9. Together. 10. Together. Very good. If you'd like to stand up, let's come up into standing and do a quick round here. You may think, sitting exercises are too easy for me. I don't need to exercise in sitting because I play tennis and I go running or go walking. But the thing is, sitting exercise is good for all of us to stretch our hips and move in certain ways. So honestly, those exercises feel really good to my body that is still just barely in my 30s. So I really anticipate that it should feel good for pretty much everyone. And sometimes it can be tough because it's really kind of getting at those Parkinson's specific things that can change. So for standing exercises, we're going to start from the beginning again with our power up to work on posture. So feet are wider apart than our hips. We're going to squat down for this one to start with. Squats are one of the best exercises we can do for strengthening it through our legs. Then we're going to stand up tall, hips forward, shoulders back, open up through your arms, a big stretch. That's 1. Down and up, 2. Down and up, 3. Down and up, 4. Down and up, 5. Down and up, 6. Down and up, 7. Down and up, 8. Down and up, 9. Down and up, 10. Very good. And there's lots of ways that we can kind of modify the power moves to focus on different things. Sometimes we go a little slower and bigger for a huge stretch. Sometimes we go a little faster to work on that symptom of bradykinesia, which is slowness of movement. We work on speeding things up so that we can go faster. So next is our rock and reach, which is for balance and weight shifting. So I got to back up a little bit. We're going to rock to the right and reach up and over with that right arm. Then we're going to rock up and over to the left for a big stretch. 2. Over to the right. 3. Maybe you can go on one leg. 4, 5, 6, 7, 8, 9, 10. Very good. Again, I'd love to do more, but we still have a few things to do and we want to get everybody on with their day. So arms open for our twist, feet wide apart. Take that right arm, turn your hips. This is our twist, working on twisting through our hips, trying to be able to pivot on that back foot for good kind of flexibility and mobility. That's 1. Open, left arm across, 2. Open, 3. Open, 4. Open, 5. Open, 6. Open, 7. Open, 8. Open, 9. Open, 10. And open. Very good. Bring your feet in about hip width apart. We are going to step out to the side. So tall posture, nice big step up and over to the right. 1. Together. Left side. 2. Together. 3. Together. 4. Together. 5. Together. 6. Together. 7. Together. 8. Together. 9. Together. 10. Together. Very good. Okay, let's continue on. So get a sip of water. And our next section that we're going to be going through is talking about some research that is looking at the things that people can do for themselves regarding lifestyle to have an influence on the progression of Parkinson's over time. There isn't really research that proves that any specific treatment is neuroprotective. For one, it's just really hard to do that kind of research and really to be able to measure and say, this is what's happening, this is protective, and this changes the course of people's Parkinson's. But we really do see in real life practice, people with Parkinson's, those of us professionals working with people, we see things that make a difference. And there is some early research indicating that there are things you can do to change the trajectory of your life. And I really believe that this is possible. So the research is done by someone named Dr. Lori Mishley, who this is another person that we highly recommend you looking into and seeing, what she has going on. She is a naturopathic doctor up in Seattle. She has this really great study called CAM Care in Parkinson's, Complementary and Alternative Medicine. So looking at things that people are doing to improve their health. And, what things seem to be effective, what is the most helpful. And the way that they are looking at that is there is a measurement called the PRO-PD. That's a self-assessment, and it measures symptoms and your experience of symptoms. And so using this measurement, they go in and then they assess and see, okay, who's doing better or worse with regards to their symptoms. And a score of 0 basically means that you either have no symptoms or they are minimally impactful to your life. The higher the score, it means there's more symptoms that are more impactful to your life and is affecting your life more. This measure has been correlated with quality of life measures to say it seems like, around 500. It's not like an exact, 500. And if your score is better than 500, you have an excellent quality of life, but that seems to be kind of cutoff levels. So if people's score is under 500, they tend to have an excellent quality of life. Between 500 and 1,000 is good. Over 1,000 starts to be more of a fair quality of life, or people are experiencing more challenges. And the thing is, there are people who've had Parkinson's for decades, like Dave is one of them, who have had Parkinson's for 20, 25 years and are doing well and exercising and living their lives the way they want to. So Dr. Mishley's research is saying, okay, what are those people doing differently who are doing so well with less, symptoms later on in the diagnosis? What are they doing with regards to their lifestyle that other people could implement now and hopefully benefit from? So her research is really cool. The 5 most influential lifestyle factors determined by Dr. Mishley's research are financial resources, which makes sense. The more financial resources you have, you're able to access potentially different types of care, neurology, certain medications, exercise and therapy. So it makes sense. Sleep, getting good sleep is really important. Diet, social life, and exercise. So I'm going to go through each of those just very briefly. When it comes to financial resources, what we would really recommend is, think about investing in yourself and your health. We understand that there are out-of-pocket expenses that come along with Parkinson's, maybe going to physical therapy or joining exercise programs that are different than you've done before, and maybe you haven't spent your money in that way. But these are the kinds of things where you can really invest in your health and your long-term health, really. And, spending some money up front to really make sure that you're getting the right kinds of exercise and access to maybe mental health services. These are the things that will have a huge impact on you over the long term. So we really recommend just kind of thinking about, with the resources and that you have financially, how you want to use your money. And then if you do have financial need, there is a wonderful nonprofit organization called Parkinson Wellness Fund that offers grants to support people living with Parkinson's to access the things that they need to have the best quality of life. So if there is, if you need assistance with accessing therapies or exercise programs or a certain piece of equipment or something like that, you can go to this website, parkinsonswellnessfund.org, and apply for a grant. And so you say what you need, why you need this help, and you ask for a certain amount to cover whatever it is that you need. And they are granting, they're offering these grants across the country to people on a very consistent and regular basis. So that is something, if you need help being able to access something, they are available to do that. So we want to make sure that people know, in addition to organizations like Parkinson Foundation, who is doing great work, Parkinson Wellness Fund exists, and they directly support individuals with the specific things that they need. So access that if that would be helpful for you. And that may be just one of the things that shifts a little bit with this diagnosis, is just thinking about exactly how you're going to spend your money and what you're going to spend money on. Sleep. So there is no such thing as perfect sleep. The question to ask yourself is, do you wake up rested? Are you able to function throughout the day? If not, you want to keep track of what is going on and bring it up with your doctor, because again, sleep is not something that just affects you on a daily basis. We all kind of know if we don't have a good night's sleep, we don't feel as good the next day. So there's a pretty quick experience of not so good sleep, but it's also something that likely has an impact on progression over time. So we want to make sure that people are getting the best sleep they possibly can, so your brain can get cleaned out, you can be well rested to exercise and do all the things that you want to do with your life. When it comes to diet and nutrition, we know that this is a huge topic, and we are not going to be spending tons of time on it today, but this is a great resource for you. So Dr. Mishley's data, she has published research. This infographic is available online. She has an online program. So there's a lot of great ways to get more details and more information. But there are some things, both in terms of dietary behaviors and then also in terms of actually the things that we eat that make a difference. So things like cooking your own meals. When you cook your own meals, for one, that's a cognitive and fine motor task, and it's practically, it's activity, but following like a new recipe is a very cognitively challenging activity, really good for us to do. So that helps you stay active. But cooking most of your meals is very beneficial. Trying to avoid artificial sweeteners is correlated with better outcomes. Trying to avoid artificial colors and flavors. Routinely preparing meals for others. I think even when you are someone who has Parkinson's and you may need some support in certain ways, there's tons of research that says that helping other people is one of the best things we can do to help ourselves. Things that are correlated with worse outcomes are when people find it difficult to afford healthy food. So, that is something to think about, figure out, try to problem solve, work with your neurologist, potentially, apply for a grant, or kind of work with your family and other resources you have to see if that can help you get better access to food. Because certainly that is, just being able to afford groceries and healthy food is something that's going to impact your life. So we know we don't have the answers to all of the challenges, but we just want to make people aware of these things. When it comes to actually what you are eating, these are the foods that are correlated with better outcomes. So like Dr. Bixby was saying at the beginning, fresh vegetables, fresh fruits, nuts and seeds, non-fried fish, wine, olive oil, coconut oil, and fresh herbs. These are the foods that have been identified in Dr. Mishley's research to be correlated with better outcomes over time. So this is what we want to try to fill up our plate with and eat the most of. Then the foods that have been correlated with worse outcomes are canned fruit, which was kind of a surprise. And there are some theories as to why that is. But ideally, that's where we want to just focus on eating more fresh as much as possible. Diet soda is correlated with worse outcomes, fried foods, ice cream, canned vegetables, beef, pasta, soda, plastic bottled drinks, chicken, pork, frozen vegetables, yogurt, cheese, and milk. So I know that's kind of a long list. It is important not to focus on things that you can't eat or think of it in a really negative way. So you can eat anything you want. It is totally up to you, and many of our quality of lives depend on what we're eating on a regular basis. So it doesn't mean that you can never eat any of these things, but you may want to try to shift your dietary habits a little bit and eat more of these types of things and see if you can minimize some of these things. Maybe there are certain things that you do eliminate from your diet. Maybe you try some plant-based products instead for dairy products. There's some really wonderful products now that are plant-based, whether it's nuts or different oils that make butters and cheeses. So just the good news is there's a lot of good things out there, and something to consider as, being supportive of your overall health and related to Parkinson's is certainly we are what we eat, and what you put in your body is going to make a difference with how you feel and how you do over the long term. social life. We've talked a lot about that already today and how important it is. And I feel like we kind of make it sound clinical, socialization, but just having support systems, friends, family, all of that is critically important. And it's one of the wonderful things that can come out of support groups and exercise classes and, being open about a diagnosis and connecting with people. There's really a lot of benefits that can come from that. And it's actually with Dr. Mishley's data, the question of asking someone whether or not they are lonely, if they answer yes to the question, are you lonely? That is actually the most impactful in terms of their quality of life, more so than any other things like asking, if someone has tremor or their other symptoms. So it's known really that social life is extremely important. And I think all of us over the past year with COVID have experienced a change in our lives and a lot of, negative effects from that. So just understand that it really is important. And as it becomes safer and safer, we want to get out and about more, be around people, and just kind of integrate back into our lives. And just know that if you have felt more stress or isolation over the past year, it's totally normal that happened based on the pandemic and the year that we've lived through. And now we want to be aware of that and start to move forward and, make choices to get back out in the world and connect with friends and family in a way that maybe we haven't been able to. And then when it comes to exercise, we've already heard a lot about that as well. Exercise is very important. Being a healthy weight is relevant for progression over time. So we really want to try to help people be a healthy weight through exercise. Just being a healthy weight makes it easier to move, when you're not carrying as much weight. It also is important, though, not to be too underweight. So that's why food is important. Eating really healthy food and eating enough food is important. When it comes to exercise, we know that intensity matters. You do want to challenge yourself, try to get your heart rate up. If that's something that you're not sure how to do or what to do, I would highly recommend that you work with a physical therapist directly first to get that exercise program started. There's research looking at the different forms of exercise and, how beneficial they are, how correlated they are with symptoms. And I think there will be more and more data that will come out to help with this. What I'd say is the most important here. So with exercise, when it comes to what you do want to do things that you enjoy, ideally, but also sometimes you need to do the things that are the most challenging. So if you notice a change in your balance, you really need to challenge your balance systems to improve it. If you notice a change in your walking, you really need to work on walking to improve it because walking is super important. So yes, you should find things that you enjoy, but you also should be ready to kind of challenge yourself to do things that are maybe not your favorite because they're very important to do to get better. And then the other thing that's important on this graph is frequency of exercise. So another thing we see a lot is that people will say, I'm exercising once or twice a week and I don't really notice much of a difference. And what Dr. Mishley's data shows is that to really experience a change in your Parkinson's symptoms, you need to exercise at least 3 days a week. Once you get to 3 days a week, you will start to experience benefit, but then each additional day you do of exercise, you will likely experience additional benefit. So I really try to recommend to people that they're exercising like 5 to 6 days a week. Ideally, maybe take one day off, although sometimes people notice when they take a day off, they don't feel as good because they're probably producing dopamine that's helping them feel better when they exercise. But this is where it kind of depends on the person. If you're exercising no days a week right now, maybe you need to start with 1 or 2 days, but just know that your goal is to get to more and more days of the week, and you will likely experience more and more benefit as you do that. So tips: exercise as often as you can. Intensity matters. Work your way up to challenging yourself, getting sweaty and out of breath and getting your heart rate up. Do the things that you enjoy, but also do the things that are challenging the systems that need to be challenged for you to get the most out of it. So I know that was kind of quick. We are available. I'll put my email in the chat. We're available for more questions afterwards, but hopefully that at least gave you an introduction to some of the things that everyone, even right after diagnosis, should be thinking about and working on to help you live your best life over the long term. If you want to learn more from Dr. Mishley, you can go to her online program, which is this website here, pd-school.teachable.com. And her website is Education as Medicine. We'll put those links in the chat as well, and they will be sent in your follow-up email. So if you didn't get a chance to write them down, that is okay. All right, so just to summarize, we want to use our financial resources the best way possible, optimize sleep, be social, eat yummy, healthy food, and exercise at least 30 minutes a day, ideally moving towards 7 days a week. So hopefully that is helpful as a way to get started. And I know it was quick, but there's still a little bit more that we want to cover. So hopefully that got you at least thinking about a few things. And let us know if you have any questions. We're going to move right along to Terry, who is one of the people who I have worked with for a number of years, who has really shown that exercise and other lifestyle changes can help you get better while living with Parkinson's. So I'm going to replace the spotlight. And Terry, we can unmute you if you are able to unmute yourself.
Yes, hi.
There we go. Hello, Terry. Thank you so much for joining. I will open up. Terry gave me a couple photos and things to use as she presents a little bit, sharing her experience, because that kind of helps organize thoughts. So I will share these slides. And Terry, if you just want to let us know, like, tell us how your age and how long you've been diagnosed with Parkinson's. That is helpful information, I think, for people to kind of put all of this in context.
Okay. I was diagnosed when I was 62 in 2009. I'm going to be 74 on Wednesday. I'm 11 and a half years into this and feeling pretty lucky, actually.
Yeah, so you can see Terry looking good after an exercise class, and I'll just share, let's see, a couple of videos. So this is Terry. Do you want to share, Terry, kind of what this video is showing?
Yeah. I'm having an emotional moment here saying this. Sorry about this. Claire is so great about asking us what it is we want to do. And I told her I wanted to learn how to jump rope again. And everybody in class, turns out, could jump rope except for me. And so she told me, just put the rope on the ground and step over it. And I didn't really believe her, but I did it. And 6 months later, I was able to jump just one time. And then a couple months later in February, I was able to jump even more. And I was retraining my brain. All that time I was retraining my brain. So it is possible to improve. You have to be focused and you have to be committed. You have to stick with it. But I wasn't jumping rope every day. I wasn't jumping rope all the time. I was doing other kinds of exercises to strengthen my legs, my heart, my lungs, my breathing, many other things. But it is possible to get better.
All right. Thank you for sharing that. And one other one. So this is, I think what is dramatic is, since I've been working with people over a long period of time, sometimes we have video. So Parkinson's, by definition, is a progressive condition. And yet Terry, when we first started working together here in 2013, had difficulty walking on the treadmill. You know, you could go about 5 minutes at a time, Terry. I don't know if you remember, and, you know, at slower speeds, and it was difficult. It was really hard work. And then 7 years later, here is Terry jogging on a treadmill, something that she could not do before. And that's 7 years later. That's pretty significant.
Yeah, it's very, very amazing. It's very amazing to me how I am continuing to get better and better and better. I know those of you look around at your friends, and I think you don't see many of your friends that are getting better. I think you're seeing your friends declining, whether or not they have Parkinson's, just because they're not taking care of themselves.
Mm-hmm. So yeah, so what you do really makes a difference. And we're just planning on collecting more and more data to show.
Who would have thought?
Sorry. To show what is possible while living with Parkinson's. All right, Terry. So I'll show, we just have this quick video that also just kind of summarizes Terry's experience.
Who would have thought somebody at 70 years old with a neurodegenerative disease that's incurable is getting better all the time?
Hi, my name is Julie Hirschberg.
I'm Sarah King.
My name is Erin Caudill.
And I'm Claire McLean. Together, we are the Neuro Collaborative.
Hi, my name is Terry, and I was diagnosed with Parkinson's when I was 62, 8 years ago. When I was diagnosed with Parkinson's, it was a huge shock. I didn't know anybody that had Parkinson's. I just thought that what was going to happen to me after these 3 years of deterioration, I just saw blackness after that. I just thought my life would end. At the time, I was told to do everything I wanted to do in the next 3 years, because after that I wouldn't be able to. I should travel and do everything. For a while I didn't do anything. I didn't really understand about physical therapy. I didn't understand how it could help me. I didn't understand that actually my insurance probably covered it 100%. I didn't know that I was entitled to it. I didn't know any of that stuff. I couldn't put on my Levi's. I had to lift my leg up to put it in one side of my pants. And to get in and out of the car, I also had to lift that right leg up to get it in and out of the car. So I knew there was something that was wrong. I decided to go to physical therapy because I was shuffling my feet and I got a fracture in my left foot and I got a lot of pain from arthritis and I was grumpy and grouchy all the time and didn't feel good. So I said, I've got to go to physical therapy for this foot so I can feel better and be happier. So that's my foot got me going to physical therapy to learn how to walk better. I started physical therapy about 3 years ago, and that got me into exercising, and I've been adding more and more exercising classes onto that. When I'm walking consistently, like 7,000 steps a day, my mood is better, my sleep is better, my appetite is better, my digestion is better. I'm just a happier person, and it's the secret magic bullet that everybody's looking for, because it makes everything in my life better. The exercise classes that I'm doing have given me a lot of energy besides helping me feel better. I have the energy and I also have the desire to interact with people. Now I'm in 2 book clubs, I'm cooking food, I'm working in the garden, trimming the plants, I'm going to LA to the theater and seeing my son. My life has really blossomed. I feel like I've actually been reborn and I'm coming alive again. Yes, with doing more exercise, I'm actually in better shape than I was in high school. The real secret in all of this is that I cannot do this by myself. If I didn't have a physical therapist who understands Parkinson's and knows how to set the bar higher while encouraging us is extremely important. I wouldn't be where I am right now without my physical therapist. And I'm looking forward to getting better and better and better. I'm going to live to be at least 90.
Awesome. Thank you so much, Terry.
Who would have?
Okay. So now a couple things that Terry wants to share.
Okay, so I'm still on my way to 90, although I think I'm going to live to be 100 now. That was me at 8 years of diagnosis. And as I said before, I'm now 11 and a half years into it. I'm going to turn 74 next week. And I'm still doing great. I still live alone. I do not have a caregiver. I take care of my house, my garden, I cook my food, I take care of my finances. This is a LA Marathon 5K with a Team Parkinson's that we've done several years. That's Claire and that's my son going across the finish line. It's a lot of fun to do that. And for me, I use it as a goal to help me stay on track during the rest of the year to make sure I'm meeting my goals, because I want to do this. I want to do this every spring.
And Terry, I also have the audio from your son here. Do you want me to play that?
No.
Okay. No?
Not yet.
Okay.
Okay, not yet. And so, so as I said a little bit before, I was diagnosed at 62, and it was very disappointing for me, as shock as it is for most people. But I had started a new career, and I was working in Century City with an architect, and I had become a lead AP, and we were taking the existing buildings and turning them into LEED Gold projects, which sometimes you've seen these buildings now with these big gold medallions on the front saying LEED Gold. They're more sustainable and green, and they save energy and things. And I was so excited to be doing that and making a whole new career for myself. And when I was diagnosed, I was like, oh my God, what's going to happen to me? I can't do this. I was commuting from Irvine to Century City. So it was really a big shock. And I got diagnosed, and after I was diagnosed and I got the word that, you know, in 3.5 years, I probably wouldn't be able to do very much. And in 10 years, I'd be bedridden and I'd be in a wheelchair. And that physical therapy was to document my decline. I said, wait a minute, this isn't who I am. This is not who I want to be. I'm not going to do this. And so I decided that I was going to rely on myself, and how important it was for me to be responsible for my life and for the kind of life that I was going to have in the future. And so, just a minute. And so for me, the turning point was really when I met Claire and I learned about physical therapy. Just a minute. And like I said before, I didn't come through the door the front way about Parkinson's. I came through the back door about with my foot. So I entered it the back way and I learned, they hooked me up with Claire because I had Parkinson's. And I learned about power moves, which were hard for me to do, as was the walking. And I could only just do a little bit. I was never physically active growing up. I never liked PE or sports or any of that stuff. But because my body enjoys it and I feel better, I keep wanting to do more. You are so fortunate to be diagnosed now in this day and age, because there is so much research out there about how wonderful exercise is for you and how exercise can slow the progression, and maybe even reverse it. Excuse me, I seem to have a little bit of a frog in my throat. But exercise is
Stephanie does, like the.
What's that?
The clearing that Stephanie taught us with.
Stephanie. Actually, you know what? It works. Even though it looks funny. That's another thing. Besides physical therapy, you need to be doing voice therapy to strengthen your lungs and your volume. But things did change when I met Claire and I learned all about exercise, and we've been learning more and more about exercise. But I wanted to say that you are so lucky to be diagnosed now, because there's so many fabulous things out there to help you. It's really wonderful. Like I said earlier, you probably look around at your friends. You don't see many of your friends that are getting better and healthier and more vibrant, I don't think. Most people seem to be kind of not taking care of themselves. I always thought about retirement is, all right, I can be on cruise control. I can do whatever I want. I can sleep in. I can eat ice cream and candy. I can have take naps all day. I treat myself. I worked hard all my life. I can treat myself and do whatever I want. But I have found that those treats are really not treats at all. They're just terrible things that make me feel worse, and do not leave me functional and happy, but leave me unhappy. So I began doing more and more exercises, and I could see I've gotten a lot better. When I met Claire, she asked me, "What would you like to do that you can't do now?" I said, "I want to go hiking with the Sierra Club." You have to go 3.0 miles per hour to go on their easiest hike. And so she's always asking, what would you like to do? It's not about what you can't do, but what you can do. And so I started walking, and I want to go on the Sierra Club walks, and here I go on the LA Marathon 5K. So it all leads up, all these steps, as my life opens up into new, wonderful new things. And so
Shall I keep going with the other photos, Terry?
Wait, yes, so now I'm ready for them. So there are 9 lifestyle changes that I would like to talk about. And the most important one, I think, is, oh no, the first one is my son's voice.
Okay.
Hi, Mom. Time to rise and shine. I know you can do it.
Okay, this is an alarm on my telephone to make me get up in the morning at 6:30 so that I'm able to be in Claire's cardio class. And for me, planning is what's really important. If you don't plan, you don't have time. And it's planning not only to get up in the morning, but it's planning going to bed the night before. I plan for success, not that day, but the day before. I've set myself up for success by planning. And one of the things that gets me out of bed is not an alarm, it's my son saying, "Good morning, Mom." So that's that. Okay, the second thing is a positive can-do attitude. I have to feel like I can do it. So as I said before, I'm the one responsible for me. I'm not, everybody has bad things happen to them, but it's how you respond to what happened to you. Your attitude about Parkinson's, your attitude about life. What am I going to do about this? Am I going to be miserable, or am I going to make something of myself? This is a wonderful book written by a woman who went on to get Parkinson's, but it's a wonderful story of something horrible that happened to her and how she used her positive attitude to turn it around. Highly recommend that book by Linda Olson. And my third thing is lifestyle choices. I have to be number one on my list of choices. I can't be, the choices I make have to do with the quality of life I have. For instance, if I'm at the doctor's and they say, the next time you come in, we want you to come in Thursday at 9 o'clock. Instead of saying, okay, I say, wait a minute, let me look at my calendar. Or let me look, this is my telephone with my schedule on the back. Oh, I see at 9 o'clock, I have power moves. Oh, I can't come at 9 o'clock. I have something else I'm doing. What other appointments do you have available? To remind myself that I have to, as Clara said before, we have to invest in ourselves and our health. We have to take care of who we are. So this is a little thing I did with my telephone, and it helps me to remember that I need to take care of me to have a better life for me so I can function and be there for other people. The next one is exercising with Claire. And no matter how you feel, get up, dress up, show up, and never, never, never give up. And do you know where this sign was posted? This is in a Beverly Hills in a men's suit store, very fine men's dress store. But really, that's the attitude. You have to get up and show up. And so the exercise classes that I do with Claire, I do at least 2 hours a day, 6 days a week. I do cardio every other day with her. And then the days in between, I either walk or row. Then I do the power moves every day. Then I do 4 hours of voice with Stephanie, swallowing and voice. And then I do Brain HQ. This is super important. Doesn't matter how you feel, just show up. Just throw your clothes on and come, because you'll come around after a while. Okay, the next one is Dr. Mishley. I follow Dr. Mishley's plant-based diet. And you can score yourself, and you can keep these, and every 6 months you take the test, and you'll see where you're improving or where you're weak and where you need to improve better. The next one is number 6. And this is about creating joy in your life, about doing things that make you happy, about doing things that make you smile, about being around people and places that just make your heart sing. For me, music is really important. And the music that resonates with most people is the music that they heard, when they were in, when they were in middle school, high school, and college. So this is my playlist on Spotify that I use for my cardio and my 5K. And it makes me happy, and it takes me out of my place and transports me to somewhere else that makes me happy. All right, the next one is congratulating myself with positive self-talk and telling myself, I love you, Terry. And this is my bathroom mirror. And that's a red lipstick that I've made that heart, and I wrote, I love you on it. And every time I walk by there, it just reminds me to be kind to myself and to thank my body for how hard it's working and how hard it's taking care of me every day. My feet and my legs, all the work, everything is doing to make my life happen. And I am very grateful for that. I actually got that idea from Louise Hay. You may have heard of publishing company called Hay House out of Escondido. She's a very positive thinking woman. I've met her once, and this is what she had in her bedroom. And I thought, oh, that's a nice idea. So I copied it. Okay, the next one, number 8. This is, again, this is another year when we did the LA 5K. It's important, I think, for us to stay in touch with the rest of the world, for us not to be isolated. We need to be able to have conversations with other people. And so I'm still in book club. I still do the 5K. It's just important to be out there. And for me, I say, if I can do this, it makes me feel, I'm going to say, more like a normal person. This is what other people do. I can do it too. I'm okay. I'm not handicapped. I'm okay. So I like this. This is one of our earlier pictures. Really a lot of fun. And let's see, the next one is, I also keep track of my weight, my blood pressure, the hours that I exercise, the food I eat, how I feel afterwards. If I eat sugar, how do I feel? Usually I feel terrible. So I write it all down, because the best way to predict the future is for you to create it yourself. And you can get better because I got better. I know you can get better too. So celebrate yourself and go out for a walk tonight. Thank you, Claire.
Awesome. Thank you so much for sharing, Terry. I think it really does help a lot of people to see someone doing so well and getting better after many years of being diagnosed, after 11 and a half years. So thank you so much for sharing your story and coming on today. There were a couple questions, but we are going to keep moving, and I'll answer some questions in the chat. And Terry, there was one about kind of when you started exercising, but we will answer those in the chat because we have basically one last thing to do today, which it's a perfect segue with Terry talking about her voice a little bit. And I've actually had a little bit of a hoarse voice recently too. That's one reason we really need to drink a lot of water. And we have our last kind of presenter and speaker of our day, Karen Skipper, which I'm so excited that she's here. I'm going to bring Lauren on to share a little bit about her, and then we'll finish up today with some more activity and exercise for our vocal system to really get strong and stay strong. So last bit of the day, we'll do this, and then we'll wrap it up.
Claire. Karen Skipper is a board certified music therapist, and she is the leader of the Orange County Tremble Clefs, which is a singing group specifically for people with Parkinson's. And they don't just sing. Karen can tell you they work on all sorts of stuff that helps swallowing and breathing and all of that. So you know better than I do, Karen. I will throw it to you to take it from here.
Thank you very much. And thank you for the nice intro. So basically, what we do in Tremble Clefs is called therapeutic singing. So we do sing, and I have people say, but I can't sing. Well, the goal is not to have you sound good. The goal is to have you do some of the things that have already been talked about, which is participate in a group, socialize through music, and also to improve our communication. And many people with Parkinson's experience deficits in communication, either by not having a loud enough voice, having a poor voice quality, or another thing that people don't think about is rate of speech. And I notice that a lot when speaking with people with Parkinson's, is the words all kind of go together, which part of that is rate, part of it's articulation. So those are some of the things that we work on in Parkinson's. So since we're up against the end of the session, I'm going to give you like a lightning round of vocal exercises that you can do to help improve your communication. So probably the most important thing in terms of speech is volume. That's what I hear the most. My voice is so quiet, and also quality, but they all have to do with breath. And in breathing, everybody says, oh, my lungs, my lungs. No, your lungs are just big old sacs that hold air. The important part of your body for breathing is the diaphragm, which is a muscle. And if you've ever seen a drum, when your diaphragm is engaged, it looks kind of like a drum head. It contracts into a flat, tight muscle. When it's relaxed, it kind of tucks up under your lungs. And it's one of those systems that we can't do, like our biceps, where we can move our arm and work our biceps. The only way to work your diaphragm and make it stronger is by breathing. So I'm going to give you an exercise now. In Tremble Clefs, we do a bunch of repetitions, but since we're limited with time, what you're going to do is you're going to breathe in through your nose. You're going to suspend your breath, which means hold your breath, and then you're going to exhale through your mouth on an SH. And I'm going to give you a beat. You can hear this beat. So we're going to breathe in for 4, suspend, hold for 4, and exhale on an SH sound for 4. So ready, inhale, go. Hold, out. When you exhale, let out all your air because we're going to breathe in again. We're going to double that. In this time, in for 4, hold for 8, exhale for 8. Ready? In for 8, in for 4, and then hold for 8. Go. Hold. Out. We're going to do one more. We're going to double it again. You're going to hold for 16, exhale for 16. Now, what we're doing is we are telling our diaphragm how slowly to relax. So that's very important because that exercise makes the diaphragm stronger, which will give you more support for your air. So in for 4, hold for 16, exhale for 16. Ready? In, hold, out. I don't know if all of you are able to make that. In treble class, we've been working on this. We've gotten up to holding and exhaling for 32 beats. So if you continue to practice, you'll only build up more tone in that diaphragm. So that's a good one for breathing. Another part of communication is our facial expression. And you know, the stereotypical Parkinson's mask, it's because muscles get stiff. And so if your muscles are stiff, people can't get the nonverbal part of your communication. If I'm surprised, I'll go, well, with Parkinson's, if your muscles are stiff, you can't use your face to communicate. So we do a lot of work on facial muscles. So one of the things I'd like you to do, and you can do this with a partner if you like, but you can kiss and then smile. Big. Kiss. Smile. So that works your lips and it works your cheeks. You should feel that. Another exercise that we do in our group is we call it sunshine and prunes. So that's the vertical. So say sunshine and open your mouth up big and your eyebrows, everything, your whole face, and prunes. And we do it with music because music affects your brain. Research, MRIs have shown that when we engage in music, it activates every part of our brain. And participating in music also causes our brain to produce dopamine, if that's anything that you would like. So anyway, as people with Parkinson's. So we're going to sing, we'll start here. Sunshine, prunes. And in treble clefs, we add just some hand movements. So when your face is closed, your hands are closed. When your face is open, stretch your fingers out. So here we go. We'll just do a few of them. Ready? Sunshine, prunes. Go up here. Sunshine, prunes. And here again, we're not going to do any more because I have many more exercises. But that helps your vocal range too, which is what we use for inflection. If I'm asking you a question, what are you wearing today? No. What are you wearing today? The inflection helps us to communicate. So that helps our facial muscles. Another important part of communication is our tongue. And the tongue actually has 8 muscles. And if your tongue doesn't work, you can't say D's, you can't say T's, you can't say S's. So your tongue needs to be in good shape too. So stick your tongue out. Do it again and go to the left. Go to the left, right. My husband calls this painting your teeth. Go the other way. So we just worked our tongue. In terms of, again, communication, our lips. Lips are full of muscles. And when muscles get stiff, your lips don't work either. So this is an exercise that people in treble clefs have a love-hate relationship with. It's called a lip trill. And what you do is you try that. If you have stiff lips because of Parkinson's, you may not be able to do that because your lips need to be flexible. If you practice, they will get more flexible, like with anything else. But it will help if you take your fingers and put them under your cheekbone and push in. Now you're not pushing forward, you're pushing in, like on your teeth. Sometimes that will help. And we're going to do a song on lip trills. And now if you can't lip trill, what the lip trill does is it works on lip flexibility, but it also puts a little bit of resistance because, as you can tell, your lips are closed. So it makes your breathing apparatus work a little harder, which again, intense working. You know, the same things that apply to physical therapy also apply to your breathing. So you have to work intensely. And it also, when you put back pressure on the air, it causes your vocal folds to open up just a little bit. And the gravelly voice that some people experience with Parkinson's, you know, kind of sounds like this, is a lot of times it's because of your vocal folds being stiff. And, you know, all that stiffness, it's not just in your gait or in your arms, it's all your muscles. So that vocal occlusion, as they call it, the back pressure can help to open up those vocal folds a little bit. So if you're not able to lip trill, we're going to do a song you might have learned as a child called The Happy Wanderer. You can also, if you can't do a lip trill, sing it on a on a hum. Or if you want to really work that diaphragm, do it on a V sound. And you will feel that in your breathing apparatus. If you want to do a, or you can whistle, because that takes a lot of lip and cheek tone. So we're going to do the song The Happy Wanderer, and we're going to do a lip trill or whatever adaptation you want to make for the verse. If you've never heard the song, you can look it up on YouTube and sing along with it at another time. But on the refrain says, Valderie, and I want you to exaggerate, Valdera, Valderie. And here's that diaphragm, Valdera, ha, 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 ha. Not ha, 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 but from your gut, ha, ha, ha. And I don't even care if you have a tune, just shout it, ha, ha, ha. And then we sing Valderie, Valdera again, last line, my knapsack on my back. Maybe we'll do it a couple times. First, we start out with lip trills or hums or bigger, Valderie, Valdera, ha, 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 Valderie, Valdera, my knapsack on my back. So we just worked all sorts of apparatus that helps us with our communication. Now, as I said earlier, one of the main issues I have with understanding people with Parkinson's when they speak to me is rate of speech. And what I've observed is people start out speaking at a normal rate. And then as they progress, it's kind of like when you start festinating. They start talking like this and it gets faster and faster and your articulation can keep up there. Nobody can understand what you're saying. So I think that one of the best tools, and not just for speech, but for gait as well, and Claire probably knows this. Terry was talking about music, is a my metronome app went. A metronome. I have a metronome app on my phone. And I think every person with Parkinson's needs to have a metronome app. And, you know, your physical therapist can give you the ideal rate of walking. How many beats per minute is your ideal speed for walking in order to get symmetry of step? A metronome, it cues your brain. And there's a saying that I love, the brain that engages in music is changed by music. And so when your brain hears that beat, it will automatically entrain to that speed, and it can even out your steps. And also if you get that optimal rate of walking, it can actually lengthen your steps because you will want to match, your brain will want to match that regular beat. But, and you know, your physical therapist can tell you what that rate of speech is. You just set your metronome. So today we're going to use it for rate of speech, not walking. And so the song we're going to use, it's a ridiculous song, and it goes like this. It's not hard, but it says, super bubble gum. The reason we do super bubble gum is you use all of the mouth sounds. You have your tongue, your lips, and gum is back here in the back of your throat. You'll feel it. So the drill goes like this. Super bubble gum. And you'll know when I add the beat. Super duper bubble gum. Super duper double bubble, super duper double bubble, super duper double bubble gum. And like with movement, the same is true. We are moving. Now we're just moving our lips and our tongue. And so I want you to be intentional about articulating. I also want you to take your hands and give yourself some neurofeedback. So this is the beat we're going to use. This is 50 beats a minute. When you hear the sound, don't watch me. Well, do watch me. But when you hear the sound, that's when you pat. And we're going to start here and sing super bubble gum. Super duper bubble gum. Super duper double bubble, super duper double bubble, super duper double bubble gum. Start here, super bubble gum. Super duper bubble gum. Super duper double bubble, super duper double bubble, super duper double bubble gum. Good. The reason I'm asking you to tap yourself is because the Parkinson's brain, if you haven't noticed by now, will deceive you. And so the more different kinds of input you can give that brain. So you're giving it oral input, you're giving it you're feeling it, a sensory input from your mouth, and also neural input from tapping yourself in rhythm. And all of that will help your brain to entrain better with that rhythm. So I have another exercise that this one we've been doing, and it's good. It's excellent for your brain. You know, we're talking about cognitive, but there is a theory, and some of you may have heard Dr. Matthew Brodsky. He's a neurologist in Portland, and he did a presentation for Parkinson's Movement Disease Alliance, and I think it was last October, about music in the brain. And he was talking about polyrhythms and the basal ganglia. Because, you know, again, anybody with Parkinson's knows the role of the basal ganglia. That's where the movement disorder part comes from, is a dysfunction in the basal ganglia. And in a normal brain, the basal ganglia pulse frequencies are asynchronous. They do not match. But in the Parkinson's brain, they are synchronous. They match. And so it was his theory, this Dr. Brodsky, that if people with Parkinson's train their brain to recognize polyrhythms, and what those are different kinds of rhythms that occur simultaneously, and I'll explain more in a minute. We'll do some of those. He said that potentially that could cause the basal ganglia to normalize. It hasn't been researched yet. He's going to do that research. But what we are going to do is we are going to do polyrhythms. We're going to do a 3-beat rhythm, a 3-syllable rhythm, a 4-syllable rhythm, and a 5-syllable rhythm. And what you will do is you will fit names of states. So for 3 beats, we're going to do Michigan. So I'm going to start a beat. Here again, there's our beat. This is 48 beats a minute. And you're going to say, Michigan, 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 Michigan. And you start the word when you hear the beat, okay? So that's 3 syllables, Michigan. So the next one we're going to do is 4 syllables. North Dakota, North Dakota. So again, when you hear the beat, North Dakota, try it. One more time. North Dakota, North Dakota, North Dakota, North Dakota, Michigan, North Dakota, Michigan, North Dakota. Got one more for you. This is the one that kicks my butt, pardon my language, is North Carolina, 5 syllables. So practice it. North Carolina, North Carolina, North Carolina, North Carolina, North Carolina, North Carolina, Michigan, North Carolina, Michigan, North Dakota, North Dakota, Michigan, North Carolina, North Carolina. Cognitive and potentially helping your basal ganglia. So it's a win-win. So I have one more for you. And Lauren mentioned in her intro that we work on swallowing. Well, I was scolded by the Speech Therapy Association that as a music therapist, addressing swallowing is not in my scope of practice. So what I'm going to say about that is, please, if you have swallowing issues, do talk to a speech therapist, because that is their area of expertise. That's what speech therapists do, is address swallowing. However, we can address some of the muscles that you use when you swallow, and what you can do to strengthen those muscles that we use when we swallow is to do an exercise. And first, I invite you to just take a dry swallow. So, or if you're drinking something, just take a swig of whatever it is you're drinking and feel what muscles you feel when you swallow whatever it is you swallow, or just saliva. So now we're going to do an exercise, and we're going to start on a low pitch. And for those of you who are musicians, this is an E. And so that's what an E sounds like. And we're going to sing the word rung and hold the NG. So we're not going rung like you would if you were singing a choir, but rung. So here we go. So follow, we're going to sing this, and we're going to do a couple different pitches. We're going to sing rung. So try that with me. Here we go. Ready? Hold the NG. Rung. Could you feel those muscles that you used when you swallowed? Now, the other thing that we're doing, and we're going to go up and start here, I want you to feel your palate, which is the part back in the back of the upper back of your throat. You will feel that lift. And that's, again, that's muscular. We're going to start here. We're going to sing rung. Could you feel that lift in your palate? So those are a few of the warm-ups we do. We do more of them. We do more repetitions for sure. But that's what Tremble Clefs is about. It's about getting together and making music, which is a group activity. It's about improving communication. And even the songs that we sing are targeting those same types of apparatus that we use. For instance, one of the songs that the Tremble Clefs is doing right now, if you're a child of the 50s and 60s, ooh, ee, ooh, ah, ah. There you go. You're using your face. We're also, we've done, if you remember Monty Python, Life of Brian, we changed the words just in case you're interested. But always look on the bright side of life. All of those reinforce all of these things that we were talking about. So as I said before, the brain that engages in music is changed by music. And that is the goal of Tremble Clefs. We are meeting via Zoom. And so that being said, we have people in our group from all over the country. We have people in our group from all over the world. And once we go back to live meetings, we are committed to keeping one meeting a week as a Zoom meeting so that we can continue to serve those people in Hawaii, in Germany, in wherever people want to join us. It's a free program. We're completely supported by donations and grants. So I put my information in the chat. If anybody wants more information, you can email me. And it is in a chat. So with that, I'm going to say thank you and turn it back over to our facilitators.
Thank you so much, Karen. That was awesome. Oh, I like doing all those exercises. And I do think it sometimes takes a little bit for people to feel comfortable, but it's so important. Our voice, communication, swallowing, breathing, that is all just as important, if not more important than our physical exercise. So hopefully that was something that was, people got exposed to some new and different things. And again, like everything else we've talked about today, these are the things that the sooner you get started working on them, the better. And it's just going to help you feel better and stronger while living with Parkinson's. So thank you again, Karen. And thank you all so much for staying on. We know right from the beginning with Dr. Bixby, we went a little bit over because there were so many good questions for her. And so I know we went a little bit longer than we intended to, but thank you all so much for sticking with us and attending today. We will be sending out the recording. So if there's anything that you want to rewatch or, try again, or come and do some of these vocal practice drills, not at the end of a 3-hour meeting, but earlier in your day, that will be available to you. It will be on YouTube. So thank you again. And Lauren, do you have anything else that you want to share before we wrap up today?
I don't think so. Just thanks everyone for coming. And if you have any questions, you can email Claire or myself. We've got lots of resources available, so take advantage of it.